1. Understanding ADHD. 1.1 What is ADHD? Attention Deficit Hyperactivity Disorder (ADHD) is a neurodevelopmental disorder that affects both children and adults. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can significantly impact daily functioning and quality of life. ADHD is one of the most common mental health disorders, affecting approximately 5–10% of children and 2–5% of adults worldwide. Understanding the symptoms. ADHD is typically diagnosed based on the presence of specific symptoms that persist over time and across different settings. These symptoms can be categorized into three main types: inattentive, hyperactive impulsive, or a combination of both. Inattentive symptoms. Individuals with inattentive symptoms often struggle with maintaining focus and paying attention to details. They may have difficulty following instructions, organizing tasks, and completing assignments or chores. Common signs of inattentive ADHD include easily getting distracted by external stimuli, frequently making careless mistakes, struggling to listen or follow conversations, forgetfulness and losing track of belongings, difficulty staying organized and managing time. Hyperactive impulsive symptoms. Hyperactive impulsive symptoms are characterized by excessive activity levels and impulsive behaviors. Individuals with these symptoms may have trouble sitting still, constantly fidgeting or squirming. They may also act impulsively without considering the consequences. Common signs of hyperactive impulsive ADHD include restlessness and difficulty staying seated, talking excessively and interrupting others, difficulty waiting for their turn, acting without thinking and taking risks, impatience and difficulty delaying gratification. Combined symptoms. Many individuals with ADHD exhibit a combination of both inattentive and hyperactive impulsive symptoms. This is known as combined type ADHD. The severity and specific symptoms can vary from person to person, and they may change over time. Onset and duration. ADHD typically begins in childhood, with symptoms often becoming noticeable around the age of 3 to 6 years. However, it is not uncommon for individuals to receive a diagnosis in adolescence or adulthood if symptoms were previously overlooked or attributed to other causes. While ADHD is considered a lifelong condition, the presentation and impact of symptoms can change as individuals grow and develop. Gender differences. ADHD affects both males and females, but there are some gender differences in how it manifests. Boys tend to display more hyperactive and impulsive behaviors, while girls may exhibit more inattentive symptoms. This difference in symptom presentation can sometimes lead to underdiagnosis or misdiagnosis in girls, as their symptoms may be less disruptive and more easily overlooked. Neurobiological factors. The exact cause of ADHD is not fully understood, but research suggests that it is a complex interplay of genetic, environmental, and neurobiological factors. Studies have shown that individuals with ADHD have differences in the structure and functioning of certain brain regions involved in attention, impulse control, and executive functions. Genetic and hereditary factors. ADHD tends to run in families, indicating a strong genetic component. Research has identified several genes that may contribute to the development of ADHD, although no single gene has been identified as the sole cause. Having a close relative with ADHD increases the likelihood of developing the disorder. Environmental factors. Certain environmental factors may also contribute to the development of ADHD. These include exposure to toxins during pregnancy, such as alcohol, tobacco, or lead, premature birth, low birth weight, and prenatal maternal stress. Additionally, growing up in chaotic or stressful environments, experiencing neglect or abuse, or having inconsistent parenting practices can increase the risk of developing ADHD symptoms. Other factors. There is ongoing research exploring the role of other factors, such as brain injuries, infections, and dietary factors, in the development of ADHD. While these factors may contribute to the manifestation of symptoms, they are not considered direct causes of the disorder. Conclusion. ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity. It affects individuals of all ages and can significantly impact various aspects of daily life. While the exact cause of ADHD is not fully understood, it is believed to result from a combination of genetic, environmental, and neurobiological factors. Understanding the symptoms and factors associated with ADHD is crucial for effective diagnosis, treatment, and management of the disorder. 1.2 Causes and risk factors. Attention Deficit Hyperactivity Disorder (ADHD) is a complex neurodevelopmental disorder that affects both children and adults. While the exact causes of ADHD are not fully understood, research suggests that it is likely to be a combination of genetic, environmental, and neurological factors. Understanding the causes and risk factors associated with ADHD can help individuals and their families navigate the challenges of managing the condition. Genetic factors. Genetic factors play a significant role in the development of ADHD. Studies have shown that ADHD tends to run in families, with a higher likelihood of having the disorder if a close relative, such as a parent or sibling, also has ADHD. Research has identified several genes that may contribute to the development of ADHD, although no single gene has been found to be solely responsible. It is important to note that having a genetic predisposition to ADHD does not guarantee that an individual will develop the disorder. Other factors, such as environmental influences, also play a role in its manifestation. Neurological factors. ADHD is associated with differences in brain structure and function. Neuroimaging studies have revealed that individuals with ADHD often have smaller brain volumes in certain regions, particularly the prefrontal cortex, which is responsible for executive functions such as attention, impulse control, and decision-making. Additionally, neurotransmitters, such as dopamine and norepinephrine, which are involved in regulating attention and impulse control, may also play a role in ADHD. Research suggests that individuals with ADHD may have imbalances or dysregulation in these neurotransmitter systems, affecting their ability to focus and control their impulses. Environmental factors. Various environmental factors have been linked to an increased risk of developing ADHD. These factors include prenatal and early childhood exposures. Exposure to certain substances during pregnancy, such as tobacco smoke, alcohol, or illicit drugs, has been associated with an increased risk of ADHD in children. Maternal stress during pregnancy and complications during childbirth, such as premature birth or low birth weight, may also contribute to the development of ADHD. Lead exposure. Exposure to lead, either through contaminated water, paint, or soil, has been linked to an increased risk of ADHD. Lead is a neurotoxin that can affect brain development and function, potentially contributing to the development of ADHD symptoms. Family and social factors. Certain family and social factors can also influence the risk of developing ADHD. These include family dysfunction or instability, parental substance abuse or mental health issues, neglect or abuse during childhood, low socioeconomic status, chaotic or disorganized home environments. While these factors may increase the risk of developing ADHD, it is important to note that they do not directly cause the disorder. ADHD is a complex condition influenced by multiple factors, and the presence of these risk factors does not guarantee the development of ADHD. Coexisting conditions. ADHD often coexists with other mental health conditions, such as anxiety disorders, depression, and learning disabilities. The presence of these conditions can complicate the diagnosis and management of ADHD. It is important for healthcare professionals to assess and address these coexisting conditions to provide comprehensive treatment and support. Conclusion. ADHD is a multifaceted disorder with a combination of genetic, neurological, and environmental factors contributing to its development. While the exact causes of ADHD are still being researched, understanding these factors can help individuals and their families navigate the challenges associated with the condition. By recognizing the potential risk factors and addressing them appropriately, individuals with ADHD can receive the necessary support and interventions to manage their symptoms effectively. 1.3 Diagnosis and Assessment. Diagnosing attention deficit hyperactivity disorder (ADHD) can be a complex process that requires a comprehensive assessment. It is crucial to obtain an accurate diagnosis to ensure appropriate treatment and support for individuals with ADHD. This section will explore the diagnostic criteria, assessment methods, and professionals involved in the diagnosis of ADHD. Diagnostic criteria for ADHD. The Diagnostic and Statistical Manual of Mental Disorders (DSM-5) is the primary reference used by healthcare professionals to diagnose ADHD. According to the DSM-5, individuals must exhibit a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with their daily functioning or development. The symptoms should be present in multiple settings, such as home, school, or work. There are 3 subtypes of ADHD outlined in the DSM-5. Predominantly inattentive presentation. Individuals with this subtype primarily struggle with inattention. They may have difficulty sustaining attention, following instructions, organizing tasks, and often appear forgetful or easily distracted. Predominantly hyperactive impulsive presentation. Individuals with this subtype primarily exhibit hyperactivity and impulsivity. They may have trouble sitting still, constantly fidget, interrupt others, and act without thinking. Combined presentation. This subtype involves a combination of both inattentive and hyperactive impulsive symptoms. It is the most common presentation of ADHD. To meet the diagnostic criteria for ADHD, the symptoms must have been present before the age of 12 and persist for at least 6 months. Additionally, the symptoms should not be better explained by another mental health condition or solely attributed to external factors such as substance abuse or medical conditions. Assessment methods for ADHD. The assessment process for ADHD typically involves gathering information from multiple sources, including the individual, their parents or caregivers, teachers, and other relevant individuals. The assessment methods may include clinical interviews. Healthcare professionals conduct interviews with the individual and their parents or caregivers to gather information about the individual's symptoms, developmental history, and daily functioning. These interviews help in understanding the individual's experiences and challenges related to ADHD. Behavioral rating scales. Rating scales, such as the ADHD rating scale, are commonly used to assess the severity and frequency of ADHD symptoms. These scales are completed by parents, teachers, and sometimes the individual themselves. They provide valuable information about the presence and impact of ADHD symptoms in different settings. Psychological testing. Psychological tests, such as cognitive assessments, may be administered to evaluate the individual's cognitive abilities, attention, and executive functioning. These tests help in identifying any specific cognitive strengths or weaknesses that may be contributing to the individual's ADHD symptoms. Observations. Observations of the individual's behavior in various settings, such as home or school, can provide valuable insights into their ADHD symptoms. Healthcare professionals may directly observe the individual or gather information from teachers or other professionals who interact with the individual regularly. Medical evaluation. A medical evaluation is essential to rule out any underlying medical conditions that may be causing or exacerbating ADHD symptoms. It may involve a physical examination, review of medical history, and laboratory tests if necessary. Professionals involved in the diagnosis of ADHD. Several professionals may be involved in the diagnosis and assessment of ADHD. These professionals work collaboratively to gather information, evaluate symptoms, and provide a comprehensive understanding of the individual's condition. The professionals involved may include primary care physicians. Primary care physicians often play a crucial role in the initial assessment and diagnosis of ADHD. They may conduct preliminary evaluations, gather information, and refer individuals to specialists for further assessment if needed. Psychiatrists. Psychiatrists are medical doctors who specialize in mental health disorders. They are qualified to diagnose ADHD and prescribe medication if necessary. Psychiatrists may also provide ongoing management and treatment for individuals with ADHD. Psychologists. Psychologists are trained in assessing and diagnosing mental health conditions. They may conduct psychological testing, interviews, and observations to evaluate ADHD symptoms. Psychologists also provide therapy and behavioral interventions to individuals with ADHD. Pediatricians. Pediatricians, who specialize in the care of children and adolescents, often diagnose ADHD in younger individuals. They may conduct initial evaluations, gather information from parents and teachers, and refer individuals to specialists for further assessment or treatment. Educational professionals. Teachers and school psychologists play a vital role in assessing ADHD symptoms in the academic setting. They provide valuable information about the individual's behavior, attention, and learning difficulties, which contributes to the overall assessment process. It is important to note that the diagnosis of ADHD should be made by qualified healthcare professionals with expertise in ADHD assessment and diagnosis. A comprehensive evaluation involving multiple sources of information ensures an accurate diagnosis and appropriate treatment planning. In the next section, we will explore the different types of ADHD and their unique characteristics. Understanding the various types of ADHD can help individuals and their support networks better comprehend the specific challenges they may face. 1.4 Types of ADHD. ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder that affects both children and adults. While ADHD is commonly associated with symptoms of inattention, hyperactivity, and impulsivity, it is important to note that there are different types of ADHD that individuals may experience. Understanding these different types can help individuals and their loved ones better manage and cope with the challenges associated with ADHD. 1.4.1 Predominantly inattentive presentation. One type of ADHD is a predominantly inattentive presentation, also known as ADHD-PI. Individuals with this type of ADHD primarily struggle with inattention and have difficulty sustaining focus and attention on tasks or activities. They may often appear forgetful, easily distracted, and have trouble organizing and completing tasks. It is important to note that individuals with ADHD-PI may not exhibit hyperactive or impulsive behaviors as prominently as those with other types of ADHD. 1.4.2 Predominantly hyperactive impulsive presentation. Another type of ADHD is a predominantly hyperactive impulsive presentation, also known as ADHD-high. Individuals with this type of ADHD primarily struggle with hyperactivity and impulsivity. They may have difficulty sitting still, constantly fidget, and have a strong urge to move around. Additionally, they may struggle with impulse control, often interrupting others, blurting out answers, and engaging in impulsive behaviors without considering the consequences. While individuals with ADHD-HI may also experience inattention, it is not as prominent as their hyperactive and impulsive behaviors. 1.4.3 Combined presentation. The most common type of ADHD is the combined presentation, also known as ADHD-C. Individuals with this type of ADHD experience a combination of both inattentive and hyperactive impulsive symptoms. They may struggle with maintaining focus, exhibit hyperactive behaviors, and have difficulty controlling their impulses. This type of ADHD can significantly impact various aspects of an individual's life, including academic performance, social interactions, and work productivity. 1.4.4 Other specified and unspecified ADHD. In addition to the three main types of ADHD, there are also two other categories: other specified ADHD and unspecified ADHD. Other specified ADHD is diagnosed when an individual's symptoms do not meet the full criteria for any of the specific types but still cause significant impairment in daily functioning. Unspecified ADHD is diagnosed when there is not enough information available to determine the specific type of ADHD or when the individual's symptoms do not fit into any of the defined categories. It is important to note that ADHD is a complex disorder, and individuals may experience symptoms that vary in severity and presentation. Some individuals may exhibit symptoms that are more characteristic of one type of ADHD, while others may display a combination of symptoms from different types. Additionally, symptoms may change over time, making it essential for individuals to regularly communicate with their healthcare providers to ensure an accurate diagnosis and appropriate treatment. Understanding the different types of ADHD can help individuals and their loved ones develop strategies and interventions that are tailored to their specific needs. By recognizing the unique challenges associated with each type, individuals can seek appropriate support and implement effective coping mechanisms to manage their symptoms. In the following chapters, we will explore various strategies, treatments, and techniques that can help individuals with ADHD thrive in different aspects of their lives. From academic performance to social skills and workplace success, this book aims to provide comprehensive guidance for managing ADHD and embracing one's strengths. 2. The impact of ADHD on daily life. 2.1 Academic challenges. Living with ADHD can present unique challenges in various aspects of life, including academics. The symptoms of ADHD, such as difficulty with focus, impulsivity, and hyperactivity, can significantly impact a person's ability to succeed in an academic setting. In this section, we will explore the specific academic challenges faced by individuals with ADHD and discuss strategies to overcome them. Difficulty with sustained attention. One of the primary academic challenges for individuals with ADHD is difficulty with sustained attention. It can be challenging to stay focused on tasks for an extended period, especially when they are not inherently stimulating or interesting. This can lead to problems with completing assignments, studying for exams, and staying engaged during lectures. To overcome this challenge, it is essential to implement strategies that promote sustained attention. Breaking tasks into smaller, more manageable chunks can help maintain focus and prevent overwhelm. Using timers or setting specific time limits for each task can also be beneficial. Additionally, creating a structured study schedule and designating specific times for focused work can help individuals with ADHD stay on track. Organization and time management. Another significant academic challenge for individuals with ADHD is organization and time management. Keeping track of assignments, deadlines, and class schedules can be overwhelming, leading to missed deadlines and incomplete work. Poor time management skills can also result in procrastination and last-minute cramming, which can negatively impact academic performance. To address these challenges, individuals with ADHD can benefit from implementing effective organizational strategies. Using tools such as planners, calendars, or digital apps can help keep track of assignments, due dates, and important deadlines. Breaking down tasks into smaller, manageable steps and creating a prioritized to-do list can also aid in managing time more effectively. Additionally, setting reminders and establishing routines can help individuals with ADHD stay organized and on top of their academic responsibilities. Difficulty with reading and comprehension. Many individuals with ADHD struggle with reading and comprehension. They may find it challenging to stay focused while reading, leading to difficulties in understanding and retaining information. This can be particularly problematic when it comes to studying for exams or completing reading assignments. To improve reading and comprehension skills, individuals with ADHD can employ various strategies. Breaking down reading material into smaller sections and taking short breaks in between can help maintain focus and prevent mental fatigue. Using visual aids, such as highlighting or underlining key points, can also enhance comprehension. Additionally, actively engaging with the material by taking notes or discussing it with others can improve understanding and retention. Test-taking difficulties. Test-taking can be a significant source of stress for individuals with ADHD. The pressure of timed exams, combined with difficulties with focus and impulsivity, can make it challenging to perform at their best. They may struggle with time management during exams, have difficulty organizing their thoughts, or become easily distracted. To overcome test-taking difficulties, individuals with ADHD can benefit from implementing specific strategies. Developing effective study habits, such as regular review sessions and practice tests, can improve knowledge retention and confidence. Creating a study environment free from distractions and utilizing noise-canceling headphones or calming music can also help maintain focus during exam preparation. During the exam itself, it can be helpful to read through all the questions before starting and allocate time for each question based on its difficulty level. Seeking support and accommodations. It is important for individuals with ADHD to seek support and accommodations in an academic setting. Many educational institutions have resources available to assist students with ADHD, such as learning support centers or disability services. These services can provide accommodations such as extended time for exams, preferential seating, or note-taking assistance. Additionally, seeking support from teachers, professors, or academic advisors can be beneficial. They can provide guidance, offer additional resources, or suggest alternative learning strategies that cater to the individual's needs. Open communication with instructors about ADHD and its impact on academic performance can help foster understanding and collaboration. In conclusion, individuals with ADHD face unique academic challenges that can impact their ability to succeed in school. However, with the right strategies and support, these challenges can be overcome. By implementing effective techniques for sustained attention, organization, reading comprehension, and test taking, individuals with ADHD can improve their academic performance and thrive in an academic setting. Seeking support and accommodations from educational institutions and fostering open communication with instructors are also crucial steps in managing ADHD-related academic challenges. 2.2 Social and relationship difficulties. Living with ADHD can present unique challenges in social and interpersonal relationships. Individuals with ADHD often struggle with maintaining focus, impulsivity, and hyperactivity, which can impact their ability to connect with others and navigate social situations effectively. In this section, we will explore the social and relationship difficulties commonly experienced by individuals with ADHD and provide strategies for managing and improving these areas of life. The impact of ADHD on social interactions. ADHD can significantly affect social interactions and relationships in various ways. Individuals with ADHD may find it challenging to listen attentively during conversations, leading to misunderstandings and miscommunication. They may also struggle with maintaining eye contact, which can be perceived as disinterest or rudeness by others. Additionally, impulsivity and hyperactivity can make it difficult for individuals with ADHD to control their behavior, leading to impulsive comments or actions that may strain relationships. Difficulties in making and maintaining friendships. Making and maintaining friendships can be particularly challenging for individuals with ADHD. The difficulties in focusing and listening can make it hard to engage in meaningful conversations and connect with others on a deeper level. The impulsivity and hyperactivity associated with ADHD can also lead to impulsive behavior or interrupting others, which can be off-putting to potential friends. Furthermore, individuals with ADHD may struggle with social cues and nonverbal communication, making it challenging to understand social norms and respond appropriately in social situations. These difficulties can lead to feelings of social isolation and low self-esteem. Challenges in romantic relationships. ADHD can also impact romantic relationships. The symptoms of ADHD, such as forgetfulness, disorganization, and difficulty with time management, can create strain and frustration within the relationship. The impulsivity and hyperactivity associated with ADHD can also lead to impulsive decisions or actions that may negatively impact the relationship. Communication can be a significant challenge in romantic relationships when one or both partners have ADHD. The difficulties in listening attentively and maintaining focus can lead to misunderstandings and miscommunication. It is essential for both partners to develop effective communication strategies and establish open and honest lines of communication to navigate these challenges successfully. Strategies for managing social and relationship difficulties. While social and relationship difficulties can be challenging for individuals with ADHD, there are strategies that can help manage and improve these areas of life. Here are some practical tips. 1. Improve communication skills. Developing effective communication skills is crucial for navigating social interactions and building strong relationships. Practice active listening by maintaining eye contact, asking clarifying questions, and summarizing what the other person has said. Additionally, work on improving nonverbal communication skills, such as body language and facial expressions, to enhance understanding and connection. 2. Seek support and education. Joining support groups or seeking therapy can provide valuable guidance and support in managing social and relationship difficulties. These resources can offer a safe space to share experiences, learn from others, and gain insights into effective strategies for building and maintaining relationships. 3. Practice emotional regulation. Emotional regulation is essential for managing impulsivity and maintaining healthy relationships. Learn techniques for managing emotions, such as deep breathing exercises, mindfulness, and journaling. By developing emotional awareness and regulation skills, individuals with ADHD can better navigate social situations and respond appropriately to emotional triggers. 4. Develop empathy and understanding. Building empathy and understanding towards others can help individuals with ADHD navigate social interactions more effectively. Take the time to consider other people's perspectives and emotions, and practice putting yourself in their shoes. This can help foster stronger connections and improve relationships. 5. Set boundaries and communicate needs. Establishing clear boundaries and effectively communicating your needs is crucial in any relationship. Be open and honest about your ADHD and how it may impact your behavior or communication. By setting boundaries and communicating your needs, you can help others understand your challenges and work together to find solutions. 6. Practice self-care. Taking care of your own well-being is essential for managing social and relationship difficulties. Prioritize self-care activities that help reduce stress and improve overall mental health. Engage in activities that bring you joy and relaxation, such as exercise, hobbies, or spending time in nature. By taking care of yourself, you can better manage the challenges that ADHD presents in social interactions and relationships. Remember, managing social and relationship difficulties takes time and practice. Be patient with yourself and celebrate small victories along the way. With the right strategies and support, individuals with ADHD can develop fulfilling and meaningful relationships. 2.3 Workplace challenges. Managing ADHD in the workplace can be a significant challenge for individuals with ADHD. The symptoms of ADHD, such as difficulty with focus, impulsivity, and hyperactivity, can impact various aspects of work performance and productivity. However, with the right strategies and support, individuals with ADHD can overcome these challenges and thrive in their professional lives. Understanding the impact of ADHD in the workplace. ADHD can affect individuals in different ways in the workplace. Some common challenges faced by individuals with ADHD include difficulty with focus and concentration. One of the core symptoms of ADHD is difficulty sustaining attention. This can make it challenging to stay focused on tasks, especially those that are repetitive or require prolonged concentration. Impulsivity and hyperactivity. Individuals with ADHD may struggle with impulsive behaviors and have difficulty controlling their impulses. This can lead to impulsive decision-making, interrupting others during meetings, and difficulty staying still or sitting for long periods. Time management and organization. ADHD can make it challenging to manage time effectively and stay organized. Individuals with ADHD may struggle with prioritizing tasks, meeting deadlines, and keeping track of important information. Procrastination and poor productivity. Due to difficulties with focus and organization, individuals with ADHD may struggle with procrastination and have lower productivity levels compared to their peers. Social and interpersonal challenges. ADHD can also impact social interactions in the workplace. Individuals with ADHD may have difficulty reading social cues, maintaining appropriate boundaries, and managing relationships with colleagues. Strategies for managing ADHD in the workplace. While managing ADHD in the workplace can be challenging, there are several strategies that can help individuals with ADHD overcome these difficulties and succeed in their professional lives. Seeking accommodations. Individuals with ADHD may benefit from workplace accommodations to help them manage their symptoms effectively. This can include flexible work hours, modified workspaces, and assistive technologies. Creating a structured environment. Establishing a structured and organized work environment can help individuals with ADHD stay focused and on track. This can involve creating a daily schedule, breaking tasks into smaller, manageable steps, and using visual aids or reminders. Utilizing time management techniques. Effective time management is crucial for individuals with ADHD. Techniques such as using timers, setting reminders, and prioritizing tasks can help individuals stay organized and meet deadlines. Minimizing distractions. Distractions can significantly impact the focus and productivity of individuals with ADHD. Creating a distraction-free workspace, using noise-canceling headphones, and implementing strategies to limit interruptions can help minimize distractions. Breaking tasks into smaller chunks. Breaking down complex tasks into smaller, more manageable chunks can make them less overwhelming for individuals with ADHD. This approach can help improve focus and increase productivity. Utilizing technology. There are numerous technological tools available that can assist individuals with ADHD in the workplace. These tools include task management apps, digital calendars, and reminder systems that can help with organization and time management. Developing effective communication skills. Clear and effective communication is essential in the workplace. Individuals with ADHD can benefit from developing active listening skills, asking for clarification when needed, and practicing effective verbal and written communication. Building a support network. Having a support network in the workplace can be invaluable for individuals with ADHD. This can include colleagues, supervisors, or mentors who understand their challenges and can provide guidance and support. Managing stress and self-care. Stress can exacerbate ADHD symptoms, so it's crucial for individuals with ADHD to prioritize self-care and stress management techniques. Engaging in regular exercise, practicing mindfulness or meditation, and maintaining a healthy work-life balance can help reduce stress levels. Advocating for yourself. It's important for individuals with ADHD to advocate for their needs in the workplace. This can involve discussing accommodations with supervisors, seeking professional support when needed, and educating colleagues about ADHD to foster understanding and support. By implementing these strategies and seeking appropriate support, individuals with ADHD can effectively manage their symptoms and thrive in the workplace. It's important to remember that everyone's experience with ADHD is unique, and finding the strategies that work best for you may require some trial and error. With persistence and determination, individuals with ADHD can overcome workplace challenges and achieve success in their careers. 2.4 Emotional and mental health effects. Living with ADHD can have a significant impact on a person's emotional and mental well-being. The challenges associated with the condition can lead to various emotional and mental health effects that individuals with ADHD may experience. It is important to understand and address these effects to promote overall well-being and improve quality of life. Emotional challenges. One of the primary emotional challenges faced by individuals with ADHD is difficulty regulating emotions. People with ADHD often struggle with impulsivity, which can lead to impulsive emotional reactions. They may experience intense emotions such as anger, frustration, and irritability, which can be overwhelming and difficult to manage. Additionally, individuals with ADHD may also struggle with emotional sensitivity. They may be more prone to feeling overwhelmed by everyday stressors and may have difficulty coping with criticism or rejection. This emotional sensitivity can make it challenging to navigate social interactions and maintain healthy relationships. Furthermore, the constant struggle to stay focused and organized can lead to feelings of frustration, low self-esteem, and self-doubt. Individuals with ADHD may often feel like they are underachieving or not meeting their own expectations, which can contribute to feelings of inadequacy and sadness. Mental health effects. ADHD is closely associated with various mental health conditions, which can further impact an individual's emotional well-being. Some common mental health conditions that often coexist with ADHD include anxiety disorders. Anxiety disorders, such as generalized anxiety disorder and social anxiety disorder, are frequently seen in individuals with ADHD. The constant worry and fear associated with anxiety can exacerbate the challenges already faced by individuals with ADHD, making it even more difficult to focus and manage daily tasks. Depression. Depression is another mental health condition that often coexists with ADHD. The constant struggle to stay organized, meet deadlines, and manage responsibilities can take a toll on an individual's mental health, leading to feelings of sadness, hopelessness, and a loss of interest in activities they once enjoyed. Oppositional defiant disorder, ODD. OD is a behavioral disorder characterized by defiance, hostility, and a tendency to argue with authority figures. It commonly coexists with ADHD, and the combination of these two conditions can lead to significant challenges in both personal and academic settings. Substance abuse. Individuals with ADHD are at a higher risk of developing substance abuse issues compared to those without the condition. The impulsivity and difficulty with self-regulation associated with ADHD can make individuals more susceptible to engaging in risky behaviors, including substance abuse, as a way to cope with their symptoms. Addressing emotional and mental health effects. Recognizing and addressing the emotional and mental health effects of ADHD is crucial for overall well-being. Here are some strategies that can help individuals manage these effects. Therapy and counseling. Seeking therapy or counseling can provide individuals with ADHD a safe space to explore and address their emotional and mental health challenges. Cognitive behavioral therapy, CBT, is often recommended as it can help individuals develop coping strategies, improve emotional regulation, and challenge negative thought patterns. Mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques can help individuals with ADHD manage their emotions and reduce stress. Techniques such as deep breathing exercises, meditation, and yoga can promote relaxation, improve focus, and enhance emotional well-being. Supportive relationships. Building a strong support network of understanding family members, friends, and peers can provide individuals with ADHD the emotional support they need. Having people who understand and validate their experiences can help reduce feelings of isolation and provide a sense of belonging. Self-care. Engaging in self-care activities is essential for individuals with ADHD to prioritize their emotional and mental well-being. This can include activities such as regular exercise, getting enough sleep, practicing hobbies, and engaging in activities that bring joy and relaxation. Medication management. For some individuals with ADHD, medication may be prescribed to help manage symptoms and improve emotional regulation. It is important to work closely with a healthcare professional to find the right medication and dosage that works best for each individual. Conclusion. The emotional and mental health effects of ADHD can significantly impact an individual's well-being. It is important to recognize and address these effects to promote overall mental health and improve quality of life. By implementing strategies such as therapy, mindfulness techniques, building a support network, practicing self-care, and considering medication management, individuals with ADHD can better manage their emotional challenges and enhance their mental well-being. 3. Medication and treatment options. 3.1 Overview of medications for ADHD. Medication is one of the most common and effective treatment options for individuals with ADHD. It can help manage the symptoms of ADHD and improve focus, attention, and impulse control. In this section, we will provide an overview of the different types of medications used to treat ADHD, their benefits, potential side effects, and considerations for choosing the right medication. Stimulant medications. Stimulant medications are the most commonly prescribed medications for ADHD. They work by increasing the levels of certain chemicals in the brain that are responsible for regulating attention and impulse control. The two main types of stimulant medications used for ADHD are methylphenidate and amphetamines. Methylphenidate. Methylphenidate is available in various forms, including immediate-release tablets, extended-release capsules, and transdermal patches. Some common brand names for methylphenidate include Ritalin, Concerta, and Daytrana. Immediate-release tablets are usually taken 2 to 3 times a day, while extended-release capsules and patches provide a longer duration of effect and are taken once daily. Methylphenidate has been shown to be effective in reducing ADHD symptoms in both children and adults. It helps improve attention, reduce impulsivity, and increase focus. However, it may cause side effects such as decreased appetite, trouble sleeping, and increased heart rate. These side effects are usually mild and tend to diminish over time. Amphetamines. Amphetamines, such as Adderall and Vyvanse, are another type of stimulant medication commonly prescribed for ADHD. They work by increasing the levels of certain neurotransmitters in the brain, which helps improve attention and impulse control. Adderall is available in immediate-release and extended-release formulations. Immediate-release tablets are usually taken 2 to 3 times a day, while the extended-release capsules are taken once daily. Vyvanse is a long-acting medication that provides a sustained effect throughout the day and is taken once in the morning. Amphetamines have been shown to be effective in reducing ADHD symptoms and improving cognitive function. They can also help individuals with ADHD stay focused and organized. However, they may cause side effects such as decreased appetite, trouble sleeping, and increased heart rate. Regular monitoring by a healthcare professional is important to ensure the medication is working effectively and to manage any potential side effects. Non-stimulant medications. In some cases, stimulant medications may not be suitable or well tolerated by individuals with ADHD. In such situations, non-stimulant medications may be prescribed as an alternative. Atomoxetine. Atomoxetine, commonly known by its brand name Strattera, is a non-stimulant medication approved for the treatment of ADHD in children, adolescents, and adults. It works by increasing the levels of norepinephrine in the brain, which helps improve attention and impulse control. Atomoxetine is usually taken once or twice daily and does not carry the risk of abuse or dependence associated with stimulant medications. It may take several weeks to see the full effects of the medication. Common side effects include upset stomach, decreased appetite, and drowsiness. Guanfacine and clonidine. Guanfacine and clonidine are medications originally developed to treat high blood pressure but have also been found to be effective in managing ADHD symptoms. They work by stimulating certain receptors in the brain that help regulate attention and impulse control. Guanfacine is available in immediate-release and extended-release formulations. Immediate-release tablets are usually taken 2 to 3 times a day, while the extended-release tablets are taken once daily. Clonidine is available in immediate-release tablets and patches. These medications are often used as adjunctive treatments to stimulant medications or as alternatives for individuals who cannot tolerate stimulants. They may be particularly helpful in managing symptoms such as impulsivity and hyperactivity. Common side effects include drowsiness, dry mouth, and low blood pressure. Considerations for choosing medication. When considering medication for ADHD, it is important to work closely with a healthcare professional who specializes in ADHD treatment. They will consider various factors, including the individual's age, medical history, and specific symptoms, to determine the most appropriate medication and dosage. It is also important to regularly monitor the effectiveness of the medication and any potential side effects. Adjustments to the dosage or medication type may be necessary to achieve optimal symptom management. In addition to medication, behavioral therapies and other non-pharmacological interventions may also be recommended as part of a comprehensive treatment plan for ADHD. These therapies can help individuals develop coping strategies, improve organizational skills, and enhance social and emotional functioning. Remember, medication is just one component of managing ADHD. It is important to combine medication with other strategies, such as creating a supportive environment, developing healthy habits, and improving executive functioning skills, to effectively manage ADHD symptoms and thrive in daily life. 3.2 Behavioral therapies. Behavioral therapies are an essential component of the comprehensive treatment approach for individuals with ADHD. These therapies focus on modifying behaviors and teaching new skills to help individuals manage their symptoms and improve their overall functioning. Unlike medication, which primarily targets the biological aspects of ADHD, behavioral therapies address the behavioral and psychological aspects of the disorder. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a widely used and evidence-based approach for treating ADHD. It aims to help individuals identify and change negative thought patterns and behaviors that contribute to their difficulties. CBT is typically conducted in a structured and goal-oriented manner, with the therapist and individual working collaboratively to set specific targets and develop strategies to achieve them. One of the key components of CBT for ADHD is psychoeducation. This involves providing individuals with information about ADHD, its symptoms, and its impact on daily functioning. By understanding the nature of their condition, individuals can gain insight into their challenges and develop a sense of empowerment. Psychoeducation also helps individuals recognize that ADHD is not a personal failing but a neurobiological condition that can be managed effectively with the right strategies. Another important aspect of CBT for ADHD is skills training. This involves teaching individuals practical techniques to improve their executive functioning skills, such as organization, time management, and planning. Through structured exercises and homework assignments, individuals learn how to break tasks into manageable steps, set realistic goals, and prioritize their activities. They also learn strategies to improve their attention, focus, and impulse control. CBT also addresses emotional regulation and self-esteem issues commonly experienced by individuals with ADHD. Therapists help individuals identify and challenge negative thoughts and beliefs that contribute to low self-esteem and emotional difficulties. By replacing negative self-talk with more positive and realistic thoughts, individuals can improve their self-confidence and emotional well-being. Parent training. Parent training programs are an integral part of behavioral therapies for children with ADHD. These programs aim to educate parents about ADHD and provide them with strategies to effectively manage their child's behavior. By equipping parents with the necessary skills, they can create a supportive and structured environment that promotes positive behavior and reduces the impact of ADHD symptoms on the child's daily life. Parent training programs typically involve teaching parents behavior management techniques, such as setting clear expectations, using positive reinforcement, and implementing consistent consequences for inappropriate behavior. Parents learn how to establish routines, create visual schedules, and provide clear instructions to help their child stay organized and focused. They also learn strategies to improve communication and strengthen the parent-child relationship. In addition to behavior management techniques, parent training programs also address the emotional and psychological needs of both the child and the parent. Parents learn how to effectively cope with the challenges of raising a child with ADHD, manage their own stress, and promote their child's self-esteem and resilience. Social skills training. Many individuals with ADHD struggle with social interactions and have difficulty maintaining positive relationships. Social skills training aims to teach individuals the necessary skills to navigate social situations, improve communication, and build and maintain relationships. Social skills training typically involves role-playing, modeling, and feedback to help individuals develop effective communication skills, such as active listening, assertiveness, and nonverbal cues. Individuals learn how to initiate and maintain conversations, resolve conflicts, and interpret social cues accurately. They also practice skills related to empathy, perspective taking, and understanding social norms. By improving their social skills, individuals with ADHD can enhance their social interactions, reduce feelings of isolation, and improve their overall quality of life. Social skills training can be conducted in individual or group settings, depending on the individual's needs and preferences. Mindfulness-based therapies. Mindfulness-based therapies, such as mindfulness-based cognitive therapy (MBCT) and mindfulness-based stress reduction (MBSR), have shown promise in helping individuals with ADHD manage their symptoms and improve their attention and self-regulation skills. These therapies involve practicing mindfulness meditation and incorporating mindfulness techniques into daily life. Mindfulness meditation helps individuals develop awareness of their thoughts, emotions, and bodily sensations without judgment. By cultivating this non-judgmental awareness, individuals can better regulate their attention, reduce impulsivity, and improve their ability to stay present and focused. Mindfulness-based therapies also emphasize acceptance and self-compassion, helping individuals develop a more positive and non-judgmental attitude towards themselves and their ADHD symptoms. By accepting their challenges and practicing self-compassion, individuals can reduce self-criticism, improve their self-esteem, and enhance their overall well-being. Conclusion. Behavioral therapies play a crucial role in managing ADHD symptoms and improving overall functioning. Cognitive behavioral therapy (CBT), parent training programs, social skills training, and mindfulness-based therapies are all effective approaches that can help individuals with ADHD develop the necessary skills to manage their symptoms, improve their relationships, and enhance their quality of life. These therapies, when combined with medication and other treatment strategies, provide a comprehensive and holistic approach to managing ADHD. 3.3 Alternative and complementary treatments. While medication and behavioral therapies are commonly used to manage ADHD, there are also alternative and complementary treatments that can be explored. These treatments can be used in conjunction with traditional approaches or as standalone options for individuals who prefer a more holistic approach to managing their symptoms. It is important to note that alternative treatments should always be discussed with a healthcare professional before implementation to ensure safety and effectiveness. 3.3.1 Mindfulness and meditation. Mindfulness and meditation practices have gained significant attention in recent years for their potential benefits in managing ADHD symptoms. These practices involve focusing one's attention on the present moment, cultivating awareness, and developing a non-judgmental attitude towards thoughts and emotions. Research suggests that mindfulness and meditation can improve attention, impulse control, and emotional regulation in individuals with ADHD. By training the mind to stay present and redirect attention when it wanders, individuals with ADHD can enhance their ability to focus and reduce distractibility. Practicing mindfulness and meditation can be done through various techniques, such as guided meditation, body scan exercises, or mindful breathing. These practices can be incorporated into daily routines and can be particularly beneficial when practiced consistently over time. 3.3.2 Yoga and physical exercise. Physical exercise, including yoga, has been shown to have positive effects on ADHD symptoms. Engaging in regular physical activity can help reduce hyperactivity, improve mood, and enhance cognitive function. Yoga, in particular, combines physical movement with breath control and mindfulness, making it a beneficial practice for individuals with ADHD. The combination of stretching, strengthening, and balancing poses, along with focused breathing, can help calm the mind, improve body awareness, and promote relaxation. Incorporating physical exercise into daily routines can be done through activities such as walking, jogging, swimming, or participating in team sports. Yoga classes specifically designed for individuals with ADHD may also be available and can provide a structured and supportive environment for practicing yoga. 3.3.3 Neurofeedback. Neurofeedback is a non-invasive technique that aims to train the brain to regulate its own activity. It involves monitoring brainwave patterns using sensors placed on the scalp and providing real-time feedback to the individual through visual or auditory cues. The goal of neurofeedback is to help individuals with ADHD learn to self-regulate their brain activity, leading to improved attention, impulse control, and overall cognitive function. By rewarding desired brainwave patterns and discouraging unwanted patterns, neurofeedback can help individuals develop more efficient brain functioning. Neurofeedback sessions are typically conducted by trained professionals and may require multiple sessions to achieve noticeable results. It is important to consult with a healthcare professional to determine if neurofeedback is a suitable option and to find a qualified practitioner. 3.3.4 Dietary Interventions. While there is limited scientific evidence supporting the effectiveness of specific diets in managing ADHD, some individuals report improvements in symptoms through dietary interventions. These interventions often involve eliminating certain foods or additives that may exacerbate ADHD symptoms and incorporating nutrient-rich foods that support brain health. One dietary approach that has gained attention is the elimination of artificial food colorings and preservatives. Some studies suggest that these additives may contribute to hyperactivity and impulsivity in children with ADHD. Additionally, ensuring a balanced diet that includes adequate amounts of protein, healthy fats, and complex carbohydrates can provide the necessary nutrients for optimal brain function. It is important to note that dietary interventions should be approached with caution and under the guidance of a healthcare professional or registered dietitian. They should not replace traditional treatments but can be used as a complementary approach to managing ADHD symptoms. 3.3.5 Herbal and nutritional supplements. Certain herbal and nutritional supplements have been explored as potential treatments for ADHD. While the evidence supporting their effectiveness is limited, some individuals may find them helpful in managing their symptoms. Omega-3 fatty acids, found in fish oil and certain plant-based sources, have been studied for their potential benefits in improving attention and reducing hyperactivity in individuals with ADHD. Other supplements, such as zinc, iron, magnesium, and vitamin B6, have also been investigated for their potential role in supporting brain function and reducing ADHD symptoms. It is important to consult with a healthcare professional before starting any herbal or nutritional supplements, as they can interact with medications or have potential side effects. Additionally, supplements should not replace traditional treatments but can be used as a complementary approach in conjunction with other management strategies. 3.3.6 Acupuncture. Acupuncture, an ancient Chinese practice, involves the insertion of thin needles into specific points on the body to restore balance and promote healing. While the research on acupuncture for ADHD is limited, some studies suggest that it may have a positive impact on symptoms such as hyperactivity, impulsivity, and inattention. Acupuncture is believed to stimulate the release of endorphins and other neurotransmitters, promoting relaxation and improving overall well-being. It is typically performed by licensed acupuncturists and may require multiple sessions to achieve noticeable results. As with any alternative treatment, it is important to consult with a healthcare professional before considering acupuncture as a management option for ADHD. They can provide guidance on its suitability and help find a qualified practitioner. Conclusion. Alternative and complementary treatments can offer additional options for individuals seeking to manage their ADHD symptoms. Mindfulness and meditation, yoga and physical exercise, neurofeedback, dietary interventions, herbal and nutritional supplements, and acupuncture are among the alternative treatments that can be explored. It is important to approach these treatments with caution, consult with healthcare professionals, and use them in conjunction with traditional approaches for optimal management of ADHD. 3.4 Managing coexisting conditions. ADHD is often accompanied by other coexisting conditions, which can further complicate the management and treatment of the disorder. These coexisting conditions can vary from person to person, but some of the most common ones include anxiety disorders, depression, learning disabilities, and oppositional defiant disorder (ODD). It is important to recognize and address these coexisting conditions in order to provide comprehensive care for individuals with ADHD. Understanding coexisting conditions. Coexisting conditions are additional mental health or developmental disorders that occur alongside ADHD. They can have a significant impact on an individual's daily functioning and overall well-being. It is estimated that up to 80% of individuals with ADHD have at least one coexisting condition. Anxiety disorders. Anxiety disorders, such as generalized anxiety disorder (GAD), social anxiety disorder, and panic disorder, are commonly seen in individuals with ADHD. The symptoms of anxiety, such as excessive worry, restlessness, and difficulty concentrating, can exacerbate the challenges already faced by individuals with ADHD. Depression. Depression is another common coexisting condition in individuals with ADHD. The symptoms of depression, such as persistent sadness, loss of interest, and changes in appetite or sleep patterns, can further impair an individual's ability to focus and function effectively. Learning disabilities. Learning disabilities, such as dyslexia or dyscalculia, often co-occur with ADHD. These learning difficulties can make academic tasks even more challenging for individuals with ADHD, leading to frustration and a negative impact on self-esteem. Oppositional defiant disorder (ODD) is characterized by a pattern of defiant, disobedient, and hostile behavior towards authority figures. It is estimated that up to 40% of children with ADHD also have ODD. The combination of ADHD and ODD can lead to significant difficulties in social relationships and academic performance. The importance of addressing coexisting conditions. Addressing coexisting conditions is crucial for effective management of ADHD. When left untreated, these conditions can exacerbate the symptoms of ADHD and hinder an individual's ability to function optimally. By identifying and treating coexisting conditions, individuals with ADHD can experience improved overall well-being and better outcomes in various areas of their lives. Integrated treatment approach. Managing coexisting conditions requires an integrated treatment approach that addresses both ADHD and the co-occurring disorders. This approach may involve a combination of medication, therapy, and lifestyle modifications. Here are some strategies for managing coexisting conditions. Medication. Medication is often prescribed to manage the symptoms of ADHD. In some cases, the same medication may also be effective in treating coexisting conditions. However, in other cases, additional medications may be necessary to address specific symptoms associated with the co-occurring disorder. It is important to work closely with a healthcare professional to find the right medication regimen. Therapy. Therapy can be beneficial in addressing both ADHD and coexisting conditions. Cognitive behavioral therapy, CBT, is commonly used to treat anxiety disorders and depression. It can help individuals develop coping strategies, challenge negative thought patterns, and improve overall emotional well-being. Additionally, specialized therapies, such as social skills training or academic support, may be beneficial for individuals with specific coexisting conditions. Lifestyle modifications. Making lifestyle modifications can also have a positive impact on managing coexisting conditions. Regular exercise, a healthy diet, and sufficient sleep can improve overall well-being and reduce symptoms of anxiety and depression. Additionally, stress management techniques, such as mindfulness or relaxation exercises, can help individuals cope with the challenges associated with ADHD and coexisting conditions. Education and support. Education and support are essential for individuals with ADHD and coexisting conditions. Learning about the specific co-occurring disorder can help individuals and their families better understand the challenges they face and develop effective strategies for managing symptoms. Support groups and counseling can provide a safe space for individuals to share their experiences, gain support, and learn from others who are facing similar challenges. Conclusion. Managing coexisting conditions is an important aspect of ADHD treatment. By addressing these conditions alongside ADHD, individuals can experience improved overall well-being and better outcomes in various areas of their lives. An integrated treatment approach that includes medication, therapy, and lifestyle modifications can help individuals effectively manage their ADHD and coexisting conditions. It is important to work closely with healthcare professionals to develop a personalized treatment plan that addresses the unique needs of each individual. 4. Developing a supportive environment. 4.1 Creating structure and routine. One of the most effective ways to manage ADHD is by creating structure and routine in your daily life. ADHD can often make it difficult to stay organized and focused, but having a structured environment can help you stay on track and manage your symptoms more effectively. In this section, we will explore the importance of creating structure and routine and provide practical tips on how to implement them in your daily life. The importance of structure and routine. For individuals with ADHD, structure and routine provide a sense of stability and predictability. They help to establish a framework for daily activities and tasks, making it easier to stay organized and focused. Here are some key benefits of creating structure and routine. Improved time management. Having a set schedule helps you allocate time for different activities and tasks, making it easier to manage your time effectively. This can help you avoid procrastination and stay on track with your responsibilities. Reduced stress and anxiety. ADHD can often lead to feelings of overwhelm and anxiety due to difficulties in managing multiple tasks and responsibilities. Having a structured routine can help alleviate these feelings by providing a clear plan and reducing uncertainty. Enhanced focus and productivity. When you have a structured routine, you are more likely to stay focused on the task at hand. By eliminating distractions and creating a dedicated time for specific activities, you can improve your productivity and accomplish more throughout the day. Improved organization. Structure and routine promote organization by establishing a system for managing tasks, appointments, and deadlines. This can help you keep track of important information and ensure that nothing falls through the cracks. Tips for creating structure and routine. Now that we understand the importance of structure and routine, let's explore some practical tips for implementing them in your daily life. Establish a daily schedule. Start by creating a daily schedule that outlines your activities and tasks. Be realistic about the time needed for each task and allocate specific time slots for different activities. Make sure to include breaks and downtime to avoid burnout. Use visual reminders. Visual cues can be helpful for individuals with ADHD. Consider using a whiteboard, sticky notes, or a digital calendar to display your schedule and important reminders. Place these visual reminders in prominent locations where you are likely to see them frequently. Set priorities. Prioritize your tasks based on importance and urgency. Identify the most critical tasks and tackle them during your peak focus times. Breaking down larger tasks into smaller, manageable steps can also help you stay motivated and avoid feeling overwhelmed. Create routines for specific activities. Establishing routines for specific activities can help streamline your daily tasks. For example, Create a morning routine that includes activities like exercise, breakfast, and getting ready for the day. Having a consistent routine can make it easier to transition between tasks and reduce decision fatigue. Minimize distractions. Identify and minimize potential distractions in your environment. This may involve turning off notifications on your phone, finding a quiet workspace, or using noise-canceling headphones. Creating a distraction-free environment can significantly improve your ability to focus and stay on task. Build in transition time. Allow yourself time to transition between activities. ADHD individuals often struggle with shifting their focus from one task to another. Building in transition time can help you mentally prepare for the next activity and reduce feelings of overwhelm. Practice self-care. Prioritize self-care activities such as exercise, relaxation techniques, and sufficient sleep. Taking care of your physical and mental well-being is crucial for managing ADHD symptoms effectively. Incorporate these activities into your daily routine to support your overall health and well-being. Remember, creating structure and routine is a personal process, and it may take some trial and error to find what works best for you. Be flexible and willing to make adjustments as needed. By implementing these tips and consistently following your structured routine, you can better manage your ADHD symptoms and improve your overall quality of life. 4.2 Organizing your physical space. One of the key strategies for managing ADHD is creating an organized and clutter-free physical environment. A disorganized space can contribute to feelings of overwhelm, distractibility, and difficulty in focusing. By organizing your physical space, you can create a calm and structured environment that supports your ability to stay focused and productive. In this section, we will explore various tips and techniques for organizing your physical space to better manage ADHD symptoms. Clearing the clutter. Clutter can be a significant source of distraction for individuals with ADHD. It can make it difficult to find things, increase feelings of stress, and hinder productivity. Therefore, the first step in organizing your physical space is to declutter and get rid of unnecessary items. Here are some tips to help you clear the clutter. Start small. Begin by tackling one area or room at a time. Trying to declutter your entire space at once can be overwhelming and may lead to frustration. Start with a small area, such as a desk or a closet, and gradually work your way through the rest of the space. Sort and categorize. As you declutter, create separate piles for items you want to keep, donate, sell, or discard. This process will help you make decisions about what to keep and what to let go of. Set realistic goals. Break down the decluttering process into manageable tasks and set specific goals for each session. For example, you could aim to declutter one drawer or shelf within a certain time frame. Celebrate your accomplishments after completing each task to stay motivated. Create designated spaces. Assign specific areas or containers for different types of items. This will make it easier to find things when you need them and maintain an organized space. Use labels or color-coded systems to help you remember where things belong. Establishing an organizational system. Once you have cleared the clutter, it's important to establish an organizational system that works for you. Here are some strategies to help you create an organized physical space. Use storage solutions. Invest in storage containers, bins, shelves, and drawers to keep your belongings organized. Use clear containers or label them to easily identify the contents. Utilize vertical space by installing shelves or using hanging organizers. Create a designated workspace. If possible, designate a specific area in your home for work or study. This will help you mentally transition into a focused mindset when you enter that space. Keep your workspace clean and free from distractions. Minimize visual distractions. Reduce visual clutter by keeping surfaces clear and minimizing the number of items on display. Use organizers or storage solutions to keep items out of sight but easily accessible when needed. Establish a daily routine. Develop a routine for tidying up your space at the end of each day. This could include tasks such as putting away items, clearing your workspace, and organizing materials for the next day. A consistent routine will help maintain an organized environment. Managing paperwork. Paperwork can quickly accumulate and become overwhelming if not properly managed. Here are some tips to help you stay on top of your paperwork. Sort and file. Establish a system for sorting and filing important documents. Use labeled folders or binders to categorize paperwork such as bills, receipts, and important documents. Regularly go through your files to discard any unnecessary papers. Digitize when possible. Consider scanning important documents and storing them digitally. This can help reduce physical clutter and make it easier to search for specific information when needed. Use cloud storage or external hard drives to keep your digital files organized. Set up a mail management system. Create a designated area for incoming mail and establish a routine for sorting and processing it. Immediately discard junk mail and sort important documents into appropriate categories. Consider setting up automatic bill payments to reduce the amount of physical paperwork. Creating visual reminders. Visual reminders can be helpful for individuals with ADHD to stay organized and remember important tasks or deadlines. Here are some strategies to create visual reminders. Use a whiteboard or chalkboard. Hang a whiteboard or chalkboard in a visible area of your home or workspace. Use it to write down important tasks, deadlines, or reminders. Update the board regularly to keep the information current. Post-it notes and sticky reminders. Place colorful sticky notes in prominent locations as visual cues for important tasks or reminders. Stick them on your computer monitor, bathroom mirror, or refrigerator as visual prompts. Calendar and planner systems. Utilize a calendar or planner system to keep track of appointments, deadlines, and commitments. Choose a system that works best for you, whether it's a physical planner, a digital calendar, or a combination of both. Set reminders and alarms to ensure you stay on top of your schedule. By organizing your physical space and implementing these strategies, you can create an environment that supports focus, productivity, and overall well-being. Remember, organizing is an ongoing process, so regularly reassess and make adjustments as needed to maintain an organized and clutter-free space. 4.3 Establishing clear expectations. One of the key strategies for managing ADHD is establishing clear expectations. When individuals with ADHD have a clear understanding of what is expected of them, it becomes easier for them to stay focused and organized. Clear expectations provide structure and guidance, helping individuals with ADHD navigate their daily tasks and responsibilities more effectively. In this section, we will explore the importance of establishing clear expectations and provide practical tips for implementing this strategy. The importance of clear expectations. Clear expectations serve as a roadmap for individuals with ADHD, helping them stay on track and meet their goals. When expectations are vague or unclear, it can lead to confusion, frustration, and a lack of motivation. This is especially true for individuals with ADHD, who often struggle with executive functioning skills such as planning, organization, and time management. By establishing clear expectations, individuals with ADHD can better understand what is required of them and how to prioritize their tasks. This clarity reduces the likelihood of feeling overwhelmed or getting sidetracked by distractions. Clear expectations also provide a sense of structure and routine, which can be particularly beneficial for individuals with ADHD who thrive in structured environments. Tips for establishing clear expectations. Be specific. When setting expectations, be as specific as possible. Clearly define what needs to be done, when it needs to be done, and how it should be done. For example, instead of saying, "Clean your room," you could say, "Please pick up all the toys from the floor, make your bed, and put your dirty clothes in the hamper by 5 p.m. Break tasks into smaller steps. For individuals with ADHD, large tasks can feel overwhelming. Breaking tasks into smaller, more manageable steps can make them feel more achievable. This approach also helps individuals with ADHD stay focused and motivated as they can see their progress along the way. Use visual aids. Visual aids, such as charts, checklists, or calendars, can be powerful tools for individuals with ADHD. These visual reminders serve as a constant reference point, helping individuals stay organized and on track. For example, you could create a daily checklist that outlines the tasks and expectations for the day. Set realistic goals. It is important to set realistic goals that take into account the individual's abilities and limitations. Unrealistic expectations can lead to frustration and a sense of failure. By setting achievable goals, individuals with ADHD can experience success and build confidence in their abilities. Provide clear instructions. When giving instructions, be clear and concise. Avoid using vague or ambiguous language. Use simple and direct language to ensure that the individual understands what is expected of them. If necessary, repeat the instructions or ask the individual to repeat them back to ensure comprehension. Establish routines. Routines provide a predictable structure that can be incredibly beneficial for individuals with ADHD. Establishing consistent routines for daily activities, such as waking up, meal times, and bedtime, can help individuals with ADHD stay organized and manage their time more effectively. Communicate openly. It is important to have open and ongoing communication with individuals with ADHD. Regularly check in with them to ensure they understand the expectations and address any questions or concerns they may have. Encourage them to ask for clarification if something is unclear. Provide feedback and reinforcement. Positive reinforcement and feedback are essential for individuals with ADHD. Acknowledge their efforts and progress, and provide praise and rewards when they meet expectations. This positive reinforcement helps to motivate and encourage individuals with ADHD to continue their efforts. Conclusion. Establishing clear expectations is a crucial strategy for managing ADHD. By providing structure, guidance, and clarity, individuals with ADHD can better navigate their daily tasks and responsibilities. Clear expectations help reduce confusion, increase motivation, and improve overall focus and organization. By implementing the tips outlined in this section, individuals with ADHD can develop a supportive environment that promotes success and well-being. 4.4 Building a support network. Living with ADHD can be challenging, but having a strong support network can make a significant difference in managing the condition effectively. Building a support network involves surrounding yourself with understanding and supportive individuals who can provide encouragement, guidance, and practical assistance when needed. In this section, we will explore the importance of a support network for individuals with ADHD and provide strategies for building and maintaining one. The importance of a support network. Having a support network is crucial for individuals with ADHD for several reasons. Here are some key benefits. Understanding and empathy. People in your support network who are knowledgeable about ADHD can offer understanding and empathy. They can relate to your experiences, challenges, and frustrations, providing a safe space for you to share your thoughts and feelings without judgment. Practical assistance. A support network can provide practical assistance in various aspects of your life. This may include helping you stay organized, reminding you of important tasks or appointments, or assisting with time management strategies. Having someone who can lend a helping hand can alleviate some of the stress and overwhelm associated with ADHD. Accountability. A support network can help you stay accountable to your goals and commitments. They can provide gentle reminders and encouragement to help you stay on track and follow through with your plans. This accountability can be especially beneficial when it comes to managing time, completing tasks, or implementing new strategies. Learning and growth. Interacting with individuals who have experience with ADHD can provide valuable insights and knowledge. They may share strategies, resources, and techniques that have worked for them, which you can incorporate into your own management plan. Learning from others who have faced similar challenges can accelerate your personal growth and development. Reduced isolation. ADHD can sometimes make individuals feel isolated or misunderstood. Building a support network can help combat these feelings by connecting you with others who share similar experiences. Knowing that you are not alone and that there are people who understand and support you can have a positive impact on your mental well-being. Strategies for building a support network. Building a support network takes time and effort, but the benefits are well worth it. Here are some strategies to help you establish and maintain a strong support network. Educate your loved ones. Start by educating your family and close friends about ADHD. Help them understand the challenges you face and the strategies you are implementing to manage your symptoms. This will create a foundation of knowledge and empathy within your immediate circle. Join support groups. Look for local or online support groups specifically for individuals with ADHD. These groups provide a platform to connect with others who share similar experiences. Participating in support group meetings or online forums can be a valuable source of support, advice, and encouragement. Seek professional support. Consider working with a therapist or counselor who specializes in ADHD. They can provide guidance, coping strategies, and emotional support. Additionally, they may be able to connect you with other individuals or resources that can further enhance your support network. Connect with ADHD organizations. Research and connect with organizations that focus on ADHD advocacy and support. These organizations often offer resources, workshops, and events that can help you connect with others in the ADHD community. They may also have online forums or support networks that you can join. Utilize social media. Social media platforms can be a great way to connect with others who have ADHD. Look for ADHD-focused groups or pages where you can engage in discussions, ask questions, and share your experiences. However, remember to use social media mindfully and prioritize genuine connections over comparison or seeking validation. Build relationships at work or school. Seek out individuals in your workplace or educational setting who are understanding and supportive. These individuals can become part of your support network and provide assistance or encouragement when needed. Consider disclosing your ADHD diagnosis to trusted colleagues or professors who can offer accommodations or understanding. Nurture existing relationships. Don't overlook the potential support that may already exist within your current relationships. Friends, family members, or colleagues who are understanding and empathetic can be valuable additions to your support network. Communicate your needs and challenges to them, and let them know how they can support you. Remember, building a support network is an ongoing process. It may take time to find the right individuals and establish meaningful connections. Be patient, open-minded, and proactive in seeking out support. With a strong support network, you can navigate the challenges of ADHD more effectively and thrive in all areas of your life. 5. Improving focus and attention. 5.1 Strategies for enhancing concentration. One of the core challenges faced by individuals with ADHD is difficulty in maintaining focus and concentration. This can significantly impact various aspects of their lives, including academics, work, and personal relationships. However, there are several strategies that can be employed to enhance concentration and improve overall productivity. In this section, we will explore some effective techniques that can help individuals with ADHD manage their attention and stay focused. 1. Break tasks into smaller, manageable chunks. One of the reasons individuals with ADHD struggle with concentration is the overwhelming nature of tasks. Breaking down tasks into smaller, more manageable chunks can make them less intimidating and easier to focus on. By dividing tasks into smaller steps, individuals can approach them one at a time, reducing the likelihood of feeling overwhelmed and increasing the chances of maintaining focus throughout the process. 2. Utilize the Pomodoro technique. The Pomodoro technique is a time management method that can be particularly helpful for individuals with ADHD. It involves breaking work into intervals, typically 25 minutes long, called Pomodoros, followed by short breaks. During each Pomodoro, the individual focuses solely on the task at hand, eliminating distractions and interruptions. After completing a Pomodoro, a short break of 5 minutes is taken, allowing for relaxation and rejuvenation. This technique helps individuals maintain focus by providing structured periods of work and rest. 3. Create a distraction-free environment. Minimizing distractions is crucial for individuals with ADHD to enhance their concentration. Creating a dedicated workspace that is free from distractions can significantly improve focus. This can be achieved by eliminating unnecessary clutter, turning off notifications on electronic devices, and using noise-canceling headphones if needed. Additionally, it can be helpful to communicate with others in the environment, such as family members or colleagues, about the importance of minimizing interruptions during designated work or study periods. 4. Use visual aids and reminders. Visual aids and reminders can serve as effective tools for individuals with ADHD to stay on track and maintain focus. Utilizing calendars, to-do lists, and sticky notes can help individuals visualize their tasks and prioritize their activities. Color-coding tasks or using visual timers can also be beneficial in managing time and increasing concentration. These visual cues serve as constant reminders and help individuals stay organized and focused on their goals. 5. Practice mindfulness and meditation. Mindfulness and meditation techniques have been shown to improve focus and attention in individuals with ADHD. Engaging in regular mindfulness exercises, such as deep breathing or guided meditation, can help calm the mind and reduce distractions. By practicing mindfulness, individuals can learn to observe their thoughts and emotions without judgment, allowing them to redirect their attention back to the task at hand. Incorporating mindfulness into daily routines can enhance concentration and overall well-being. 6. Use technology to your advantage. While technology can be a source of distraction, it can also be harnessed to enhance concentration for individuals with ADHD. There are numerous apps and tools available that can help individuals stay organized, manage their time, and minimize distractions. These include task management apps, focus-enhancing apps, and noise-canceling apps. Experimenting with different tools and finding the ones that work best for individual needs can significantly improve concentration and productivity. 7. Engage in physical activity. Physical activity has been shown to have a positive impact on focus and attention. Engaging in regular exercise, such as walking, jogging, or yoga, can help individuals with ADHD release excess energy and improve their ability to concentrate. Exercise increases blood flow to the brain, promoting the release of neurotransmitters that enhance focus and cognitive function. Incorporating physical activity into daily routines can provide a natural boost to concentration and overall mental well-being. 8. Practice self-care and maintain a healthy lifestyle. Taking care of oneself is essential for managing ADHD symptoms and enhancing concentration. This includes getting enough sleep, eating a balanced diet, and managing stress levels. Lack of sleep and poor nutrition can significantly impact focus and attention, making it crucial to prioritize healthy habits. Additionally, managing stress through relaxation techniques, such as deep breathing exercises or engaging in hobbies, can help individuals maintain a clear mind and improve concentration. 9. Seek support and accountability. Having a support system in place can be invaluable for individuals with ADHD. Seeking support from family, friends, or support groups can provide encouragement and accountability. Sharing goals and progress with others can help individuals stay motivated and focused on their tasks. Additionally, working with a coach or therapist who specializes in ADHD can provide guidance and strategies tailored to individual needs, further enhancing concentration and overall well-being. By implementing these strategies and techniques, individuals with ADHD can improve their ability to concentrate and manage their attention more effectively. It is important to remember that everyone is unique, and what works for one person may not work for another. Experimenting with different strategies and finding the ones that resonate and produce positive results is key to developing a personalized approach to enhancing concentration and thriving with ADHD. 5.2 Minimizing distractions. One of the biggest challenges for individuals with ADHD is managing distractions. With a mind that is easily pulled in different directions, staying focused on a task can be incredibly difficult. However, there are strategies and techniques that can help minimize distractions and improve concentration. In this section, we will explore some effective methods to create a more focused environment. Create a distraction-free workspace. Having a dedicated workspace that is free from distractions is essential for individuals with ADHD. This space should be organized, clutter-free, and designed to promote focus. Here are some tips to create a distraction-free workspace. Remove visual distractions. Clear your workspace of unnecessary items that may catch your attention. Keep only the essentials within reach and store other items out of sight. Minimize auditory distractions. Find a quiet area to work in, away from noisy environments. If you cannot avoid background noise, consider using noise-canceling headphones or playing soft instrumental music to mask distractions. Limit digital distractions. Turn off notifications on your electronic devices to prevent constant interruptions. Consider using website blockers or apps that limit access to distracting websites or social media platforms during work or study sessions. Establish boundaries. Communicate with others in your household or workspace about your need for uninterrupted time. Set clear boundaries and let them know when you are not to be disturbed unless it is an emergency. Use time blocking techniques. Time blocking is a powerful technique that can help individuals with ADHD stay focused and manage their time effectively. By allocating specific time blocks for different tasks or activities, you create a structured schedule that reduces the likelihood of getting distracted. Here's how you can implement time blocking. Identify your priorities. Determine the most important tasks or activities that need to be accomplished during the day. Prioritize them based on urgency and importance. Allocate time blocks. Assign specific time blocks for each task or activity. Be realistic about the time needed for each task and allow for breaks in between to prevent burnout. Stick to the schedule. Once you have established your time blocks, commit to following them as closely as possible. Avoid deviating from the schedule unless absolutely necessary. Set reminders. Use alarms or reminders to alert you when it's time to transition to the next task or activity. This will help you stay on track and prevent time from slipping away unnoticed. Implement visual cues and organizational systems. Visual cues and organizational systems can be incredibly helpful in minimizing distractions and improving focus. By creating a visual structure and using tools to stay organized, you can reduce the mental clutter that often leads to distraction. Here are some strategies to consider. Use color coding. Assign specific colors to different tasks, projects, or categories. Use colored folders, sticky notes, or digital labels to visually differentiate between them. This visual organization can help you quickly identify and prioritize tasks. Utilize checklists and to-do lists. Break down larger tasks into smaller, manageable steps. Create checklists or to-do lists to keep track of your progress and provide a visual representation of what needs to be done. Employ visual timers. Use visual timers or countdown clocks to help you stay on track and manage your time effectively. These tools provide a visual representation of the passing time and can serve as a reminder to stay focused. Organize your digital files. Create folders and subfolders on your computer or digital devices to keep your files organized. Use clear and descriptive file names to make it easier to locate specific documents when needed. Practice mindfulness and deep breathing. Mindfulness and deep breathing exercises can help individuals with ADHD calm their minds, reduce anxiety, and improve focus. By incorporating these practices into your daily routine, you can train your brain to become more present and less susceptible to distractions. Here's how to get started. Mindful breathing. Take a few moments throughout the day to focus on your breath. Close your eyes, take slow, deep breaths, and pay attention to the sensation of the air entering and leaving your body. This simple practice can help ground you in the present moment and reduce mental chatter. Body scan meditation. Sit or lie down in a comfortable position and bring your attention to different parts of your body, starting from your toes and moving up to your head. Notice any sensations or areas of tension, and consciously release any physical or mental tension you may be holding. Mindful breaks. Incorporate short mindful breaks into your day. Set aside a few minutes to engage in a calming activity such as stretching, walking in nature, or listening to soothing music. These breaks can help reset your focus and reduce stress. Practice acceptance. Instead of getting frustrated or overwhelmed by distractions, practice accepting them without judgment. Acknowledge that distractions are a normal part of life and gently guide your attention back to the task at hand. By implementing these strategies and techniques, you can create a more focused environment and minimize distractions. Remember that managing ADHD requires patience and persistence, so be kind to yourself as you navigate this journey towards improved focus and attention. 5.3 Utilizing time management techniques. Time management is a crucial skill for individuals with ADHD. It helps them stay organized, prioritize tasks, and make the most of their time. Effective time management techniques can significantly improve focus and productivity, reduce stress, and enhance overall well-being. In this section, we will explore various strategies and tools that can help individuals with ADHD better manage their time. 1. Create a daily schedule. One of the most effective time management techniques for individuals with ADHD is creating a daily schedule. Having a structured plan for the day helps in staying focused and on track. Start by listing all the tasks and activities you need to accomplish for the day. Break them down into smaller, manageable tasks and allocate specific time slots for each task. Be realistic about the time required for each task and allow for breaks in between. Use a planner, calendar, or digital tools to keep track of your schedule. 2. Prioritize tasks. Prioritizing tasks is essential for individuals with ADHD as it helps them focus on what is most important. Start by identifying the tasks that are urgent and need immediate attention. Then, consider the tasks that are important but not urgent. Finally, identify tasks that can be postponed or delegated. By prioritizing tasks, you can ensure that you are allocating your time and energy to the most critical activities. 3. Break tasks into smaller steps. Large tasks can be overwhelming for individuals with ADHD, leading to procrastination and difficulty in getting started. Breaking tasks into smaller, more manageable steps can make them less intimidating and easier to tackle. Create a checklist or use a task management app to break down tasks into smaller subtasks. This approach not only helps in staying organized but also provides a sense of accomplishment as you complete each step. 4. Set realistic deadlines. Setting realistic deadlines is crucial for effective time management. Individuals with ADHD often struggle with estimating the time required to complete tasks accurately. As a result, they may underestimate the time needed, leading to rushed work or missed deadlines. To avoid this, give yourself some buffer time when setting deadlines. Consider factors such as potential distractions, unexpected interruptions, and the complexity of the task. By setting realistic deadlines, you can reduce stress and ensure that you have enough time to complete your tasks effectively. 5. Use time blocking. Time blocking is a technique that involves allocating specific time blocks for different activities or tasks. It helps in creating a structured routine and ensures that you dedicate focused time to each task. Start by identifying your most productive hours of the day and allocate them for tasks that require high concentration. Block out distractions during these time periods and focus solely on the task at hand. Use timers or alarms to remind yourself when it's time to switch to the next task. 6. Utilize reminders and alarms. Individuals with ADHD often struggle with forgetfulness and may lose track of time easily. Utilizing reminders and alarms can be incredibly helpful in managing time effectively. Set reminders for important deadlines, appointments, and tasks. Use alarms to signal the start and end of specific time blocks. You can use smartphone apps, digital calendars, or even sticky notes as visual reminders. Experiment with different methods to find what works best for you. 7. Minimize distractions. Distractions can significantly impact productivity and time management for individuals with ADHD. Minimizing distractions is crucial for maintaining focus and staying on track. Create a distraction-free environment by eliminating or reducing potential interruptions. Turn off notifications on your phone or computer, close unnecessary tabs or apps, and find a quiet space to work. If you find it challenging to resist distractions, consider using productivity apps or browser extensions that block access to distracting websites or apps during designated work periods. 8. Practice time awareness. Developing a sense of time awareness is essential for individuals with ADHD. It involves being mindful of how you spend your time and being aware of how long tasks take to complete. Start by tracking your time for various activities using a timer or a time tracking app. This practice can help you understand how much time you spend on different tasks and identify areas where you may need to make adjustments. Over time, you will develop a better sense of time and be able to allocate it more effectively. 9. Delegate and outsource. Recognize that you don't have to do everything yourself. Delegating tasks to others or outsourcing certain responsibilities can help free up your time and reduce overwhelm. Identify tasks that can be assigned to others, whether it's at work, home, or school. Consider seeking support from family members, friends, or colleagues. Additionally, explore outsourcing options for tasks such as house cleaning, meal preparation, or administrative work. By delegating and outsourcing, you can focus on the tasks that require your attention the most. 10. Practice self-care. Taking care of yourself is crucial for managing ADHD effectively. Engaging in self-care activities helps reduce stress, improve focus, and enhance overall well-being. Prioritize activities such as exercise, meditation, adequate sleep, and relaxation techniques. Engage in hobbies or activities that bring you joy and help you recharge. Remember that self-care is not a luxury but a necessity for maintaining optimal mental and emotional health. By utilizing these time management techniques, individuals with ADHD can improve their focus, productivity, and overall quality of life. Experiment with different strategies and tools to find what works best for you. Remember that effective time management is a skill that can be developed with practice and patience. 5.4 Enhancing working memory. Working memory is a cognitive function that allows us to temporarily hold and manipulate information in our minds. It plays a crucial role in our ability to focus, follow instructions, solve problems, and complete tasks. For individuals with ADHD, working memory deficits are common and can significantly impact their daily lives. However, there are strategies and techniques that can help enhance working memory and improve overall cognitive functioning. Understanding working memory. Before we delve into strategies for enhancing working memory, it's important to understand what working memory is and how it functions. Working memory is often described as the brain's mental workspace, or mental scratchpad. It involves the temporary storage and manipulation of information needed for tasks such as reading, problem solving, and decision making. Working memory consists of three main components. Central executive. This component acts as the control center of working memory, directing attention and coordinating the other two components. It helps filter out irrelevant information and prioritize tasks. Phonological loop. The phonological loop is responsible for the temporary storage and manipulation of verbal and auditory information. It plays a crucial role in tasks such as reading, listening, and verbal reasoning. Visual spatial sketchpad. The visual spatial sketchpad handles visual and spatial information. It allows us to mentally visualize objects, navigate through space, and manipulate visual information. Strategies for enhancing working memory. Chunking. Breaking down complex information into smaller, more manageable chunks can help reduce the cognitive load on working memory. For example, when trying to remember a long list of items, grouping them into categories or creating acronyms can make it easier to recall. Repetition and practice. Regular repetition and practice can help reinforce information in working memory and improve retention. Reviewing and rehearsing important information multiple times can strengthen neural connections and make it easier to retrieve later. Visualization. Using visual imagery can enhance working memory performance. For instance, when trying to remember a series of instructions, visualizing each step as a vivid mental image can make it easier to recall and follow through. Mnemonic devices. Mnemonic devices are memory aids that help us remember information through associations or patterns. Techniques such as acronyms, rhymes, and visualization can be effective in enhancing working memory. For example, using the acronym Roy G. Biv to remember the colors of the rainbow: red, orange, yellow, green, blue, indigo, violet. External memory aids. Utilizing external memory aids can offload some of the cognitive demands on working memory. Tools such as calendars, to-do lists, sticky notes, and smartphone reminders can help individuals with ADHD stay organized and remember important tasks and deadlines. Active listening. When receiving verbal instructions or information, actively engaging in the listening process can improve working memory. This involves focusing attention, asking clarifying questions, and mentally summarizing the information to reinforce understanding and retention. Mindfulness and meditation. Practicing mindfulness and meditation techniques can help improve working memory by enhancing attentional control and reducing mind wandering. Regular mindfulness exercises can train the brain to stay focused on the present moment and minimize distractions. Breaks and rest. Taking regular breaks during mentally demanding tasks can prevent cognitive overload and fatigue. Giving the brain time to rest and recharge can improve working memory performance and overall cognitive functioning. Physical exercise. Engaging in regular physical exercise has been shown to have positive effects on working memory. Exercise increases blood flow to the brain, promotes the growth of new neurons, and enhances cognitive function. Incorporating aerobic activities, such as jogging or swimming, into your routine can help boost working memory. Sleep. Sufficient sleep is essential for optimal cognitive functioning, including working memory. Lack of sleep can impair attention, memory, and overall cognitive performance. Establishing a consistent sleep routine and ensuring an adequate amount of sleep can help enhance working memory. Reduce distractions. Minimizing distractions in your environment can help improve working memory. Find a quiet and clutter-free space to work or study, turn off notifications on your electronic devices, and use noise-canceling headphones if necessary. Practice multitasking. Engaging in activities that require multitasking can help train and improve working memory. For example, playing strategy games, solving puzzles, or learning to play a musical instrument can challenge and enhance your cognitive abilities. Remember, enhancing working memory takes time and practice. It's important to be patient with yourself and celebrate small victories along the way. By implementing these strategies consistently, you can strengthen your working memory and improve your ability to focus, learn, and succeed in various aspects of life. 6. Managing impulsivity and hyperactivity. 6.1 Coping with impulsive behaviors. Impulsivity is a common symptom of ADHD that can significantly impact daily life. Individuals with ADHD often struggle with acting before thinking, making impulsive decisions, and having difficulty controlling their impulses. These impulsive behaviors can lead to negative consequences, strained relationships, and challenges in various areas of life. However, there are strategies and techniques that can help individuals with ADHD cope with and manage their impulsive behaviors effectively. Understanding impulsivity. Impulsivity is characterized by a lack of forethought and a tendency to act on immediate desires or urges without considering the potential consequences. It can manifest in various ways, such as interrupting others, blurting out inappropriate comments, engaging in risky behaviors, or making impulsive purchases. Impulsivity can be particularly challenging for individuals with ADHD, as their brains have difficulty regulating impulses and inhibiting immediate responses. Recognizing triggers. One of the first steps in coping with impulsive behaviors is to identify the triggers that lead to impulsive actions. Triggers can vary from person to person, but common ones include stress, boredom, frustration, or excitement. By recognizing these triggers, individuals with ADHD can become more aware of their impulsive tendencies and develop strategies to manage them effectively. Pause and reflect. When faced with an impulsive urge or desire, it can be helpful to pause and take a moment to reflect before acting. This pause allows individuals to consider the potential consequences of their actions and make a more thoughtful decision. Taking a deep breath, counting to 10, or physically removing oneself from the situation can provide the necessary space to regain control and make a more rational choice. Utilize cognitive behavioral techniques. Cognitive behavioral techniques can be highly effective in managing impulsive behaviors. One such technique is cognitive restructuring, which involves challenging and replacing impulsive thoughts with more rational and logical ones. For example, instead of immediately reacting to a frustrating situation, individuals can remind themselves to take a step back, evaluate the situation objectively, and consider alternative responses. Another useful technique is behavioral rehearsal, where individuals practice and rehearse alternative responses to impulsive situations. By mentally preparing for challenging scenarios, individuals can develop a repertoire of more controlled and thoughtful reactions. Develop self-awareness. Developing self-awareness is crucial in managing impulsive behaviors. By becoming more attuned to their thoughts, emotions, and physical sensations, individuals can recognize the early signs of impulsivity and intervene before it escalates. Mindfulness practices, such as meditation or deep breathing exercises, can help individuals cultivate self-awareness and improve their ability to regulate impulsive urges. Create a supportive environment. Having a supportive environment can significantly aid in coping with impulsive behaviors. Informing family members, friends, and colleagues about ADHD and its impact on impulsivity can help them understand and provide necessary support. It is essential to communicate specific strategies or cues that others can use to help redirect impulsive behaviors gently. Implement structure and routine. Establishing structure and routine can be highly beneficial for individuals with ADHD in managing impulsivity. Having a predictable schedule and clear expectations can reduce the likelihood of impulsive actions. Breaking tasks into smaller, manageable steps and setting realistic deadlines can also help individuals stay focused and avoid impulsive decision-making. Practice delayed gratification. Delayed gratification is a valuable skill for managing impulsivity. It involves resisting immediate rewards or desires in favor of long-term goals or benefits. Individuals with ADHD can practice delayed gratification by setting goals, creating action plans, and rewarding themselves after completing tasks or achieving milestones. This practice helps build patience, self-control, and the ability to resist impulsive urges. Seek professional support. For individuals with ADHD who struggle significantly with impulsive behaviors, seeking professional support can be beneficial. Mental health professionals, such as therapists or counselors, can provide guidance, teach coping strategies, and help individuals develop personalized techniques for managing impulsivity. Additionally, medication prescribed by a healthcare professional may also be considered as part of a comprehensive treatment plan for ADHD. Celebrate progress. Managing impulsive behaviors is an ongoing process, and it is essential to celebrate progress along the way. Recognize and acknowledge small victories, such as successfully resisting an impulsive urge or making a more thoughtful decision. Celebrating progress boosts self-confidence and motivation, making it easier to continue practicing and refining coping strategies. In conclusion, coping with impulsive behaviors is a crucial aspect of managing ADHD. By understanding impulsivity, recognizing triggers, utilizing cognitive behavioral techniques, developing self-awareness, creating a supportive environment, implementing structure and routine, practicing delayed gratification, seeking professional support, and celebrating progress, individuals with ADHD can effectively manage their impulsive behaviors and lead more fulfilling lives. 6.2 Strategies for managing hyperactivity. Hyperactivity is a common symptom of ADHD that can significantly impact daily life. It can manifest as excessive restlessness, fidgeting, impulsivity, and difficulty staying still or quiet. Managing hyperactivity is crucial for individuals with ADHD to improve focus, productivity, and overall well-being. In this section, we will explore various strategies that can help individuals with ADHD effectively manage their hyperactivity. 1. Physical activity and exercise. Engaging in regular physical activity and exercise can be highly beneficial for individuals with ADHD, especially those who experience hyperactivity. Exercise helps release excess energy, improves focus, and promotes better sleep. It also stimulates the production of neurotransmitters like dopamine and norepinephrine, which play a crucial role in regulating attention and impulse control. Encourage activities that involve movement, such as sports, dancing, yoga, or martial arts. These activities not only provide an outlet for hyperactivity but also promote discipline, self-control, and teamwork. It's important to find activities that the individual enjoys and can sustain over time to ensure consistency and long-term benefits. 2. Breaks and movement breaks. Taking regular breaks throughout the day can help manage hyperactivity and improve focus. Short breaks allow individuals to release excess energy and reset their attention. Encourage the use of timers or alarms to remind individuals to take breaks at regular intervals. In addition to regular breaks, incorporating movement breaks into daily routines can be highly effective. These breaks involve engaging in brief physical activities, such as stretching, walking, or doing jumping jacks. Movement breaks can be particularly helpful during tasks that require sustained focus, as they provide a quick burst of physical activity to release restlessness and improve concentration. 3. Mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques can help individuals with ADHD manage hyperactivity by promoting self-awareness, reducing stress, and improving impulse control. Mindfulness involves paying attention to the present moment without judgment, which can help individuals become more aware of their thoughts, emotions, and physical sensations. Encourage the use of mindfulness techniques such as deep breathing exercises, progressive muscle relaxation, or guided imagery. These techniques can be practiced for a few minutes each day or whenever hyperactivity becomes overwhelming. They help individuals calm their minds, regulate their emotions, and reduce impulsivity. 4. Sensory strategies. Sensory strategies can be effective in managing hyperactivity by providing sensory input that helps individuals regulate their energy levels and focus. These strategies involve engaging the senses to create a calming or stimulating environment based on individual preferences. Some sensory strategies include providing fidget toys or stress balls to channel excess energy, using noise-canceling headphones or playing soft background music to minimize auditory distractions, creating a designated sensory space with items like beanbags, weighted blankets, or sensory bins filled with materials like sand or rice, using aromatherapy with calming scents like lavender or chamomile. Experiment with different sensory strategies to identify what works best for each individual. It's important to note that sensory preferences can vary, so it's essential to involve the individual in the process and respect their sensory needs. 5. Structured routines and schedules. Establishing structured routines and schedules can help individuals with ADHD manage hyperactivity by providing a sense of predictability and reducing impulsivity. Having a consistent daily routine helps individuals know what to expect and minimizes the need for constant decision-making, which can be overwhelming. Create a visual schedule or use a planner to outline daily activities, tasks, and responsibilities. Break tasks into smaller, manageable steps and allocate specific time slots for each activity. This helps individuals stay organized, prioritize tasks, and maintain focus. Incorporate regular breaks and physical activities into the schedule to address hyperactivity effectively. 6. Environmental modifications. Making modifications to the physical environment can help individuals with ADHD manage hyperactivity. Creating an environment that minimizes distractions and supports focus can significantly improve productivity and reduce restlessness. Some environmental modifications include designating a quiet and clutter-free workspace, using dividers or noise-canceling headphones to minimize auditory distractions, removing unnecessary visual stimuli from the workspace, using task-specific tools or apps to stay organized and manage time effectively. Experiment with different environmental modifications to identify what works best for each individual. It's important to create an environment that promotes focus and minimizes potential triggers for hyperactivity. 7. Social support and communication. Having a strong support network and open communication channels can be invaluable in managing hyperactivity. Educate family members, friends, teachers, and colleagues about ADHD and its impact on hyperactivity. Encourage them to provide understanding, patience, and support. It can be helpful to establish a system of cues or signals that indicate when hyperactivity is becoming overwhelming. This allows individuals to communicate their needs without drawing unnecessary attention or causing embarrassment. Encourage open dialogue and problem-solving discussions to find strategies that work for everyone involved. 8. Professional support. Seeking professional support from healthcare providers, therapists, or ADHD coaches can provide valuable guidance and strategies for managing hyperactivity. These professionals can help individuals develop personalized coping mechanisms, address specific challenges, and provide ongoing support. Remember, managing hyperactivity is a continuous process that requires patience, experimentation, and a willingness to adapt strategies as needed. By implementing these strategies and seeking support, individuals with ADHD can effectively manage their hyperactivity and improve their overall well-being. 6.3 Channeling energy in productive ways. One of the key challenges faced by individuals with ADHD is managing their energy levels. People with ADHD often have high levels of energy, which can manifest as restlessness, fidgeting, and a constant need for movement. This excess energy can be both a blessing and a curse. On one hand, it can fuel creativity and drive. On the other hand, it can lead to impulsivity and distractibility. In order to effectively manage ADHD, it is important to find ways to channel this energy in productive ways. By directing their energy towards activities that are engaging and meaningful, individuals with ADHD can harness their potential and achieve their goals. Here are some strategies for channeling energy in productive ways. 1. Physical exercise. Engaging in regular physical exercise is one of the most effective ways to channel excess energy. Exercise not only helps to burn off energy but also releases endorphins, which can improve mood and focus. Activities such as running, swimming, dancing, or playing a sport can provide an outlet for restless energy and help individuals with ADHD feel more calm and centered. 2. Creative outlets. Many individuals with ADHD have a natural inclination towards creativity. Engaging in creative activities can be a great way to channel energy in a productive way. Whether it's painting, writing, playing a musical instrument, or engaging in crafts, creative outlets provide an opportunity for self-expression and focus. These activities can also serve as a form of therapy, allowing individuals with ADHD to process their thoughts and emotions in a constructive manner. 3. Hobbies and interests. Encouraging individuals with ADHD to pursue hobbies and interests that they are passionate about can be highly beneficial. Whether it's gardening, cooking, photography, or playing video games, having a hobby can provide a sense of purpose and fulfillment. By channeling their energy into activities they enjoy, individuals with ADHD can experience a sense of accomplishment and satisfaction. 4. Mindfulness and meditation. Practicing mindfulness and meditation can help individuals with ADHD to calm their minds and focus their energy. Mindfulness involves paying attention to the present moment without judgment, while meditation involves training the mind to achieve a state of deep relaxation and concentration. These practices can help individuals with ADHD become more aware of their thoughts and emotions, and develop greater control over their impulses. 5. Structured activities. Engaging in structured activities can help individuals with ADHD channel their energy in a productive way. This can include participating in organized sports, joining clubs or organizations, or taking part in structured classes or workshops. These activities provide a sense of structure and routine, which can help individuals with ADHD stay focused and engaged. 6. Volunteer work. Getting involved in volunteer work can be a meaningful way for individuals with ADHD to channel their energy in a productive way. By helping others and contributing to their community, individuals with ADHD can experience a sense of purpose and fulfillment. Volunteer work can also provide opportunities for social interaction and skill development. 7. Career choices. Choosing a career that aligns with their interests and strengths can be crucial for individuals with ADHD. By pursuing a career that allows them to channel their energy in a productive way, individuals with ADHD can thrive in their professional lives. Careers that involve creativity, problem solving, and hands-on activities can be particularly well suited for individuals with ADHD. 8. Time management techniques. Effective time management is essential for individuals with ADHD to channel their energy in a productive way. By breaking tasks into smaller, manageable chunks and setting realistic deadlines, individuals with ADHD can stay focused and avoid becoming overwhelmed. Utilizing tools such as calendars, to-do lists, and reminders can also help individuals with ADHD stay organized and on track. 9. Seeking support. It is important for individuals with ADHD to seek support from professionals, such as therapists or coaches, who specialize in ADHD management. These professionals can provide guidance and strategies for channeling energy in productive ways. Additionally, joining support groups or connecting with others who have ADHD can provide a sense of community and understanding. In conclusion, channeling energy in productive ways is essential for individuals with ADHD to effectively manage their symptoms. By engaging in physical exercise, pursuing creative outlets, participating in structured activities, and practicing mindfulness, individuals with ADHD can harness their energy and achieve their goals. It is important for individuals with ADHD to explore different strategies and find what works best for them in order to lead a fulfilling and successful life. 6.4 Developing self-control techniques. Self-control is a crucial skill for individuals with ADHD. It involves the ability to regulate one's thoughts, emotions, and behaviors in order to achieve desired goals and outcomes. Developing self-control techniques can significantly improve focus, attention, and overall executive functioning. In this section, we will explore various strategies and techniques that can help individuals with ADHD enhance their self-control abilities. 1. Mindfulness and meditation. Mindfulness and meditation practices have gained significant attention in recent years for their ability to improve focus, reduce stress, and enhance self-control. These practices involve bringing one's attention to the present moment and cultivating a non-judgmental awareness of thoughts, emotions, and sensations. For individuals with ADHD, mindfulness and meditation can be particularly beneficial in developing self-control. By practicing mindfulness, individuals can learn to observe their thoughts and impulses without immediately acting on them. This increased awareness allows for a pause, giving individuals the opportunity to choose a more appropriate response rather than impulsively reacting. To incorporate mindfulness and meditation into your daily routine, consider setting aside a few minutes each day for practice. Find a quiet and comfortable space, close your eyes, and focus on your breath or a specific point of attention. As thoughts arise, simply observe them without judgment and gently bring your attention back to your breath or chosen focal point. Over time, regular practice can help strengthen your ability to regulate your thoughts and impulses. 2. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a widely recognized therapeutic approach that can be highly effective in improving self-control for individuals with ADHD. CBT focuses on identifying and challenging negative thought patterns and replacing them with more positive and adaptive ones. In the context of self-control, CBT can help individuals with ADHD recognize and modify impulsive and automatic thoughts that often lead to impulsive behaviors. By learning to identify triggers and thought patterns associated with impulsive actions, individuals can develop alternative, more controlled responses. Working with a trained therapist, individuals can learn specific techniques such as cognitive restructuring, problem solving, and behavioral activation to enhance self-control. CBT provides practical strategies that can be applied in real-life situations, empowering individuals to make more deliberate and thoughtful choices. 3. Self-monitoring and journaling. Self-monitoring and journaling can be valuable tools for developing self-control. By keeping track of thoughts, emotions, and behaviors, individuals can gain a better understanding of their patterns and triggers. This self-awareness is essential for developing strategies to manage impulsive behaviors and enhance self-control. Consider keeping a journal where you record your daily experiences, including any impulsive actions or thoughts that arise. Reflect on these entries regularly to identify patterns and triggers. By becoming more aware of your impulsive tendencies, you can begin to implement strategies to interrupt and redirect these behaviors. Additionally, self-monitoring can involve tracking progress towards specific goals or desired behaviors. By regularly assessing your progress, you can make adjustments and celebrate successes, which can further motivate and reinforce self-control. 4. Implementation intentions. Implementation intentions are specific plans that outline how and when you will engage in a desired behavior. By creating clear and detailed plans, individuals can enhance their self-control by reducing the need for impulsive decision-making in the moment. To create an implementation intention, start by identifying a specific behavior or goal you want to work on. Then, determine the specific circumstances or triggers that typically lead to impulsive actions. Finally, create a detailed plan that outlines how you will respond differently in those situations. For example, if you struggle with impulsive spending, you might create an implementation intention like, When I feel the urge to make an impulsive purchase, I will wait 24 hours and reassess if it aligns with my budget and financial goals. By having a predetermined plan in place, you can reduce the likelihood of impulsive actions and make more deliberate choices. 5. Environmental modifications. Modifying your environment can also support self-control and reduce impulsive behaviors. By creating an environment that minimizes distractions and promotes focus, individuals with ADHD can enhance their ability to regulate their thoughts and actions. Consider organizing your physical space in a way that reduces visual and auditory distractions. Clear clutter, create designated spaces for specific activities, and minimize noise distractions. Additionally, establish clear boundaries and rules for your environment to provide structure and reduce impulsive behaviors. Furthermore, utilizing tools such as timers, alarms, and reminders can help individuals stay on track and manage their time effectively. These external cues can serve as reminders to pause, reflect, and make more intentional choices. 6. Social support and accountability. Seeking social support and accountability can be instrumental in developing self-control. By involving trusted individuals in your journey, you can receive encouragement, guidance, and feedback that can help reinforce self-control efforts. Consider sharing your goals and challenges with a close friend, family member, or support group. Regular check-ins and discussions can provide valuable insights and support. Additionally, consider finding an accountability partner who can help hold you responsible for your actions and provide motivation when needed. Remember, developing self-control is a process that takes time and practice. Be patient with yourself and celebrate small victories along the way. With consistent effort and the implementation of these techniques, you can enhance your self-control and effectively manage ADHD symptoms. 7. Improving executive functioning skills. 7.1 Enhancing planning and organization. One of the key challenges faced by individuals with ADHD is difficulties with planning and organization. These difficulties can manifest in various aspects of life, including work, school, and daily routines. However, with the right strategies and techniques, it is possible to enhance planning and organization skills and effectively manage ADHD symptoms. In this section, we will explore some practical tips and strategies to help individuals with ADHD improve their planning and organization abilities. Breaking tasks into smaller steps. One of the most effective ways to enhance planning and organization skills is by breaking tasks into smaller, more manageable steps. This approach helps individuals with ADHD to focus on one step at a time, reducing feelings of overwhelm and increasing productivity. When faced with a complex task or project, it can be helpful to create a checklist or a to-do list outlining each step that needs to be completed. By crossing off each completed step, individuals can track their progress and stay motivated. Utilizing visual aids and reminders. Visual aids and reminders can be powerful tools for individuals with ADHD to improve planning and organization. Using calendars, planners, or digital tools can help individuals keep track of important dates, deadlines, and appointments. It is important to choose a system that works best for each individual's preferences and needs. Some individuals may prefer traditional paper-based planners, while others may find digital calendars or smartphone apps more convenient. Whichever method is chosen, it is crucial to regularly review and update the planner to ensure nothing is overlooked. Establishing routines and schedules. Establishing routines and schedules can provide structure and predictability, which are essential for individuals with ADHD. Having a consistent daily routine can help individuals stay organized and manage their time effectively. It is important to establish a routine that includes specific times for waking up, meals, work or study periods, breaks, and bedtime. By following a routine, individuals can reduce decision-making fatigue and create a sense of stability in their daily lives. Creating a designated workspace. Having a designated workspace is crucial for individuals with ADHD to stay organized and focused. This space should be free from distractions and clutter, allowing individuals to concentrate on their tasks. It is important to keep the workspace tidy and organized, with all necessary materials and supplies easily accessible. Creating a visually appealing and comfortable workspace can also help individuals feel motivated and engaged in their work. Using technology to aid organization. In today's digital age, there are numerous technological tools and apps available to assist individuals with ADHD in planning and organization. These tools can help with tasks such as setting reminders, creating to-do lists, managing schedules, and organizing files. Some popular apps include Evernote, Trello, and Google Calendar. It is important to explore different options and find the tools that work best for each individual's needs and preferences. Prioritizing tasks and setting deadlines. Prioritizing tasks and setting deadlines is essential for effective planning and organization. Individuals with ADHD often struggle with prioritization and may find it challenging to determine which tasks are most important. One helpful approach is to use the ABC method, where tasks are categorized as a high priority, B medium priority, or C low priority. By focusing on completing high priority tasks first, individuals can ensure that the most important responsibilities are addressed in a timely manner. Setting deadlines for each task can also provide a sense of urgency and help individuals stay on track. Seeking support and accountability. Seeking support and accountability from others can be beneficial for individuals with ADHD in improving planning and organization skills. This can involve enlisting the help of a trusted friend, family member, or mentor who can provide guidance and encouragement. Additionally, joining support groups or seeking professional assistance from therapists or coaches who specialize in ADHD can provide valuable strategies and support. Practicing self-care and stress management. Taking care of oneself and managing stress is crucial for individuals with ADHD to maintain optimal planning and organization abilities. Engaging in regular exercise, practicing relaxation techniques such as deep breathing or meditation, and getting enough sleep are all important aspects of self-care. By managing stress levels, individuals can improve their focus, concentration, and overall ability to plan and organize effectively. In conclusion, enhancing planning and organization skills is essential for individuals with ADHD to effectively manage their symptoms and thrive in various aspects of life. By breaking tasks into smaller steps, utilizing visual aids and reminders, establishing routines, creating a designated workspace, using technology, prioritizing tasks, seeking support, and practicing self-care, individuals can significantly improve their planning and organization abilities. With consistent practice and the right strategies, individuals with ADHD can overcome challenges and achieve success in their personal and professional lives. 7.2 Improving time management. Time management is a crucial skill for individuals with ADHD. Many people with ADHD struggle with managing their time effectively, which can lead to feelings of overwhelm, stress, and a lack of productivity. However, with the right strategies and techniques, it is possible to improve time management skills and create a more organized and structured daily routine. Understanding time perception. One of the challenges individuals with ADHD face is a distorted perception of time. They may struggle with accurately estimating how long tasks will take or underestimate the time needed to complete them. This can lead to a constant feeling of being rushed or running out of time. To improve time management, it is important to develop a better understanding of time perception. One effective strategy is to use timers or alarms to create a visual and auditory reminder of the passing time. Set specific time limits for tasks and use a timer to keep track of how much time is being spent on each activity. This can help individuals with ADHD stay focused and avoid getting lost in time-consuming tasks. Prioritizing tasks. Another key aspect of effective time management is prioritizing tasks. Individuals with ADHD often struggle with prioritization, as they may feel overwhelmed by the number of tasks they need to complete. This can lead to a scattered approach, where they jump from one task to another without making significant progress on any of them. To overcome this challenge, it is important to prioritize tasks based on their importance and urgency. One helpful technique is the Eisenhower matrix, which categorizes tasks into 4 quadrants: urgent and important, important but not urgent, urgent but not important, and neither urgent nor important. By categorizing tasks in this way, individuals with ADHD can focus their time and energy on the most important and urgent tasks first, while also ensuring that less urgent but still important tasks are not neglected. Breaking tasks into smaller steps. Large tasks can be overwhelming for individuals with ADHD, making it difficult to get started or stay focused. Breaking tasks into smaller, more manageable steps can make them feel less daunting and increase the likelihood of completing them. To break tasks into smaller steps, start by identifying the main goal or outcome of the task. Then, break it down into smaller subtasks or actions that need to be completed to achieve that goal. For example, if the task is to write a research paper, the subtasks could include conducting research, creating an outline, writing the introduction, and so on. By focusing on one small step at a time, individuals with ADHD can make progress without feeling overwhelmed. Using visual tools and reminders. Visual tools and reminders can be powerful aids for individuals with ADHD in managing their time effectively. These tools provide a visual representation of tasks, deadlines, and schedules, making it easier to stay organized and on track. One effective visual tool is a calendar or planner. Use it to schedule tasks, appointments, and deadlines, and refer to it regularly to stay aware of upcoming commitments. Color-coding tasks or using different symbols can help differentiate between different types of activities and make it easier to prioritize. In addition to calendars and planners, individuals with ADHD can also benefit from using visual reminders. Sticky notes, whiteboards, or digital reminders can be placed in prominent locations to serve as visual cues for important tasks or deadlines. These reminders can help individuals with ADHD stay focused and remember important commitments. Minimizing distractions. Distractions can significantly impact time management for individuals with ADHD. They may find it challenging to stay focused on a task when there are external stimuli or internal thoughts pulling their attention away. To minimize distractions, it is important to create a conducive environment for concentration. This can include finding a quiet space to work, turning off notifications on electronic devices, and using noise-canceling headphones if necessary. It may also be helpful to establish specific times for checking emails or engaging in social media to avoid getting sidetracked. Implementing time blocking. Time blocking is a technique that involves scheduling specific blocks of time for different activities or tasks. This method can be particularly beneficial for individuals with ADHD, as it provides structure and helps allocate time effectively. To implement time blocking, start by identifying the most important tasks or activities that need to be completed each day. Then, assign specific time blocks for each task, ensuring that there is enough time allocated for breaks and transitions between activities. It can be helpful to set reminders or alarms to signal the start and end of each time block. By following a structured schedule and dedicating specific time blocks to different tasks, individuals with ADHD can improve their time management skills and increase their productivity. Seeking support and accountability. Managing time effectively can be challenging, especially for individuals with ADHD. Seeking support and accountability from others can provide valuable assistance in staying on track and achieving goals. Consider enlisting the help of a coach, therapist, or support group specifically focused on ADHD. These professionals can provide guidance, strategies, and support tailored to the unique challenges of managing time with ADHD. Additionally, sharing goals and progress with a trusted friend or family member can provide accountability and motivation. Celebrating progress. Improving time management skills is a journey, and it is important to celebrate progress along the way. Recognize and acknowledge small achievements, such as completing tasks on time or sticking to a schedule. Celebrating progress can help boost motivation and reinforce positive habits. Remember, managing time effectively is a skill that can be developed and improved with practice. By implementing these strategies and techniques, individuals with ADHD can enhance their time management skills and create a more organized and productive daily routine. 7.3 Developing decision-making skills. One of the key challenges individuals with ADHD often face is difficulty in making decisions. This can be attributed to various factors, including impulsivity, distractibility, and trouble with prioritizing and weighing options. However, developing effective decision-making skills is crucial for managing ADHD and navigating through daily life successfully. In this section, we will explore strategies and techniques to help individuals with ADHD improve their decision-making abilities. Understanding decision-making. Before delving into specific strategies, it is important to understand the process of decision-making. Decision-making involves evaluating different options, considering the potential outcomes and consequences, and selecting the best course of action. For individuals with ADHD, this process can be overwhelming and challenging due to difficulties in focusing, organizing thoughts, and managing impulsivity. Strategies for developing decision-making skills. Gather information. Making informed decisions requires gathering relevant information. Take the time to research and gather all the necessary facts and details about the decision you need to make. This will help you have a clearer understanding of the situation and the available options. Identify goals and priorities. Before making a decision, it is important to identify your goals and priorities. What do you hope to achieve? What are the most important factors to consider? By clarifying your goals and priorities, you can narrow down your options and make decisions that align with what is most important to you. Consider pros and cons. Create a list of the pros and cons of each option. This will help you evaluate the potential benefits and drawbacks of each choice. Consider the short-term and long-term consequences of each option and weigh them against your goals and priorities. Break it down. Sometimes, decisions can feel overwhelming, especially when there are multiple factors to consider. Break down the decision into smaller, more manageable parts. Focus on one aspect at a time and make decisions step by step. This can help reduce overwhelm and make the decision-making process more manageable. Seek input and advice. Don't be afraid to seek input and advice from others. Consult with trusted friends, family members, or professionals who can provide a different perspective or offer valuable insights. Sometimes, discussing your options with others can help you gain clarity and make more informed decisions. Practice delayed gratification. Individuals with ADHD often struggle with impulsivity and the desire for immediate gratification. Practice delaying gratification by taking the time to think through your options and consider the long-term consequences. Remind yourself that making impulsive decisions may not lead to the best outcomes. Utilize visual aids. Visual aids can be helpful in organizing thoughts and weighing options. Consider using tools such as mind maps, decision matrices, or flowcharts to visually represent the decision-making process. These visual aids can help you see the connections between different options and make more informed choices. Set realistic deadlines. Setting deadlines for decision-making can help prevent procrastination and ensure that you make timely choices. However, it is important to set realistic deadlines that allow you enough time to gather information and consider your options. Avoid rushing into decisions due to self-imposed time constraints. Reflect and learn. After making a decision, take the time to reflect on the outcome and learn from the experience. Did the decision align with your goals and priorities? What worked well, and what could have been done differently? Reflecting on your decisions can help you improve your decision-making skills over time. Practice mindfulness. Incorporating mindfulness techniques into your decision-making process can help you stay present and focused. Practice deep breathing or meditation to calm your mind and reduce impulsivity. Being mindful can help you make decisions with greater clarity and intention. Remember, developing decision-making skills is a process that takes time and practice. Be patient with yourself and celebrate small victories along the way. By implementing these strategies and techniques, individuals with ADHD can improve their decision-making abilities and make choices that align with their goals and priorities. 7.4 Building problem-solving abilities. Problem-solving is a crucial skill for individuals with ADHD to develop. It allows them to navigate through challenges, make effective decisions, and find solutions to various situations. Building problem-solving abilities can significantly enhance executive functioning skills and improve overall daily functioning. In this section, we will explore strategies and techniques to help individuals with ADHD strengthen their problem-solving skills. Understanding the problem. The first step in problem-solving is to clearly understand the problem at hand. Individuals with ADHD may struggle with this step due to difficulties with attention and focus. To overcome this challenge, it can be helpful to break down the problem into smaller, more manageable parts. This allows for a more focused and systematic approach to problem-solving. One effective technique is to write down the problem in a clear and concise manner. This helps to organize thoughts and gain a better understanding of the issue. Additionally, creating a visual representation of the problem, such as a mind map or flowchart, can provide a visual aid that aids in comprehension. Generating possible solutions. Once the problem is understood, the next step is to generate possible solutions. Individuals with ADHD often have a unique perspective and can think outside the box, which can be advantageous in problem solving. However, they may also struggle with impulsivity and jump to conclusions without considering all options. To overcome this challenge, it is helpful to encourage brainstorming and generate as many potential solutions as possible. This can be done individually or in a group setting. It is important to create a non-judgmental and supportive environment that allows for free thinking and creativity. All ideas should be considered, even if they seem unconventional or unrealistic at first. Evaluating and selecting the best solution. Once a list of potential solutions has been generated, the next step is to evaluate and select the best solution. This requires critical thinking and weighing the pros and cons of each option. Individuals with ADHD may struggle with this step due to difficulties with decision-making and impulsivity. To overcome this challenge, it can be helpful to create a decision-making matrix or a list of criteria to evaluate each solution. This allows for a more systematic and objective approach to decision-making. Each potential solution can be evaluated based on factors such as feasibility, effectiveness, and potential risks or benefits. By considering these factors, individuals with ADHD can make more informed decisions. Implementing the solution. Once the best solution has been selected, the next step is to implement it. Individuals with ADHD may struggle with follow-through and maintaining focus on the chosen solution. To overcome this challenge, it is important to break down the implementation process into smaller, manageable steps. Creating a detailed action plan with specific tasks and deadlines can help individuals with ADHD stay organized and focused. It is also helpful to set reminders and create visual cues to prompt action. Breaking down the implementation process into smaller steps not only makes it more manageable but also provides a sense of accomplishment as each step is completed. Reflecting and learning from the experience. After implementing the solution, it is important to reflect on the experience and learn from it. This step is often overlooked but is crucial for personal growth and development. Individuals with ADHD can benefit from reflecting on what worked well, what could have been done differently, and what lessons were learned from the problem-solving process. Reflection allows individuals to gain insights into their problem-solving abilities and identify areas for improvement. It also helps to build resilience and adaptability, as individuals can apply the lessons learned to future problem-solving situations. Encouraging self-reflection and providing positive reinforcement for effort and progress can further enhance problem-solving skills. Seeking support and collaboration. Problem-solving does not have to be a solitary endeavor. Seeking support and collaboration can greatly enhance the problem-solving process for individuals with ADHD. Engaging with others who have different perspectives and experiences can provide valuable insights and alternative solutions. Collaboration can take various forms, such as seeking advice from trusted individuals, joining support groups or therapy sessions, or working with a coach or mentor. These interactions can provide emotional support, guidance, and accountability, which can be instrumental in building problem-solving abilities. Practice, patience, and persistence. Building problem-solving abilities is a skill that requires practice, patience, and persistence. Individuals with ADHD may face setbacks and challenges along the way, but it is important to remain resilient and continue working towards improvement. By consistently practicing problem-solving techniques and strategies, individuals with ADHD can strengthen their executive functioning skills and become more adept at navigating through various challenges. With time and effort, problem-solving can become a natural and effective process for individuals with ADHD, empowering them to overcome obstacles and achieve their goals. In conclusion, building problem-solving abilities is essential for individuals with ADHD to effectively navigate through challenges and find solutions. By understanding the problem, generating possible solutions, evaluating and selecting the best solution, implementing it, reflecting on the experience, seeking support and collaboration, and practicing consistently, individuals with ADHD can enhance their problem-solving skills and improve their overall daily functioning. 8. Building healthy habits. 8.1 Importance of sleep and rest. Sleep and rest play a crucial role in managing ADHD symptoms and promoting overall well-being. Individuals with ADHD often struggle with sleep-related issues, such as difficulty falling asleep, staying asleep, or having restless sleep. These sleep disturbances can further exacerbate the challenges associated with ADHD, including inattention, impulsivity, and hyperactivity. In this section, we will explore the importance of sleep and rest for individuals with ADHD and provide strategies for improving sleep quality. The impact of sleep on ADHD symptoms. Adequate sleep is essential for optimal brain function and cognitive performance. For individuals with ADHD, sleep deprivation can significantly worsen their symptoms. Lack of sleep can lead to increased impulsivity, decreased attention span, and heightened hyperactivity. It can also impair executive functioning skills, such as decision-making, problem-solving, and emotional regulation. Research has shown that sleep deprivation affects the prefrontal cortex, the part of the brain responsible for executive functions. This impairment can make it even more challenging for individuals with ADHD to focus, organize tasks, and control impulsive behaviors. Additionally, sleep deprivation can contribute to mood swings, irritability, and difficulties with emotional regulation, which are common in individuals with ADHD. Establishing a healthy sleep routine. Creating a consistent sleep routine is crucial for individuals with ADHD to improve their sleep quality. Here are some strategies to establish a healthy sleep routine. Set a regular sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. Consistency helps regulate the body's internal clock and promotes better sleep. Create a calming bedtime routine. Engage in relaxing activities before bed, such as reading a book, taking a warm bath, or practicing mindfulness exercises. Avoid stimulating activities, such as using electronic devices or engaging in intense physical exercise, close to bedtime. Create a sleep-friendly environment. Make sure your bedroom is conducive to sleep. Keep the room cool, dark, and quiet. Consider using earplugs, eye masks, or white noise machines to block out any distractions. Limit exposure to screens. The blue light emitted by electronic devices can interfere with the production of melatonin, a hormone that regulates sleep. Avoid using screens, such as smartphones, tablets, or computers, at least an hour before bedtime. Avoid caffeine and stimulants. Caffeine and other stimulants can disrupt sleep patterns. Limit your consumption of caffeinated beverages, such as coffee, tea, and energy drinks, especially in the afternoon and evening. Exercise regularly. Engaging in regular physical activity can promote better sleep. However, try to avoid intense exercise close to bedtime, as it can increase alertness and make it harder to fall asleep. Manage stress. Stress and anxiety can interfere with sleep. Practice stress management techniques, such as deep breathing exercises, meditation, or journaling, to help calm your mind before bed. Strategies for improving sleep quality. In addition to establishing a healthy sleep routine, there are several strategies that can help individuals with ADHD improve their sleep quality. Create a sleep-friendly bedroom. Make your bedroom a comfortable and relaxing space. Invest in a supportive mattress and pillows. Use blackout curtains to block out light, and ensure proper ventilation. Avoid napping. If you have trouble falling asleep at night, try to avoid daytime napping. If you must nap, limit it to a short duration, around 20 to 30 minutes, and avoid napping too close to bedtime. Limit bedroom activities. Reserve your bedroom for sleep and intimacy only. Avoid using your bed for work, studying, or watching TV. By associating your bed with sleep, you can train your brain to recognize it as a place of rest. Practice relaxation techniques. Incorporate relaxation techniques into your bedtime routine. Deep breathing exercises, progressive muscle relaxation, or guided imagery can help calm your mind and prepare your body for sleep. Consider cognitive behavioral therapy for insomnia, CBTI. CBTI is a type of therapy specifically designed to address sleep problems. It focuses on identifying and changing negative thoughts and behaviors that contribute to insomnia. Consult with a healthcare professional to explore CBTI as a potential treatment option. Avoid alcohol and nicotine. While alcohol may initially make you feel drowsy, it can disrupt your sleep patterns and lead to fragmented sleep. Similarly, nicotine is a stimulant that can interfere with sleep. Avoid consuming alcohol and nicotine close to bedtime. Seek professional help. If you have tried various strategies and still struggle with sleep-related issues, it may be beneficial to consult with a healthcare professional. They can assess your specific situation and provide personalized recommendations or interventions. Remember, improving sleep quality takes time and consistency. Be patient with yourself as you establish new habits and routines. By prioritizing sleep and rest, you can enhance your overall well-being and better manage the symptoms of ADHD. 8.2 Nutrition and ADHD. Proper nutrition plays a crucial role in managing ADHD symptoms and promoting overall well-being. While there is no specific ADHD diet, making healthy food choices can significantly impact focus, attention, and behavior. In this section, we will explore the relationship between nutrition and ADHD and provide practical tips for incorporating a balanced diet into your daily routine. The impact of nutrition on ADHD. Research suggests that certain nutrients and dietary patterns can influence brain function and potentially improve ADHD symptoms. While individual responses may vary, here are some key factors to consider. 1. Omega-3 fatty acids. Omega-3 fatty acids, particularly EPA and DHA, are essential for brain health and development. Studies have shown that individuals with ADHD often have lower levels of these fatty acids in their blood. Increasing omega-3 intake through dietary sources or supplements may help reduce symptoms such as inattention, hyperactivity, and impulsivity. Good sources of omega-3 fatty acids include fatty fish like salmon, mackerel, and sardines, as well as walnuts, flax seeds, and chia seeds. If you choose to take supplements, consult with a healthcare professional to determine the appropriate dosage. 2. Protein. Protein is essential for the production of neurotransmitters, the chemical messengers in the brain. Including adequate protein in meals and snacks can help stabilize blood sugar levels and promote sustained focus and attention. Opt for lean sources of protein such as poultry, fish, beans, lentils, and tofu. 3. Complex carbohydrates. Complex carbohydrates provide a steady release of glucose, the brain's primary source of energy. Including whole grains, fruits, vegetables, and legumes in your diet can help maintain stable blood sugar levels and prevent energy crashes. Avoid refined carbohydrates like sugary snacks and white bread, as they can lead to fluctuations in energy levels and worsen ADHD symptoms. 4. Vitamins and minerals. Certain vitamins and minerals are involved in neurotransmitter synthesis and play a role in brain function. While more research is needed, deficiencies in nutrients like iron, zinc, magnesium, and vitamin D have been associated with ADHD symptoms. Including a variety of fruits, vegetables, whole grains, and lean proteins in your diet can help ensure you're getting an adequate intake of these essential nutrients. Practical tips for a balanced diet. Now that we understand the impact of nutrition on ADHD, let's explore some practical tips for incorporating a balanced diet into your daily routine. 1. Eat regular meals and snacks. Establishing a regular eating schedule can help stabilize blood sugar levels and maintain consistent energy levels throughout the day. Aim to have 3 balanced meals and 2 to 3 healthy snacks in between. Include a combination of protein, complex carbohydrates, and healthy fats in each meal or snack to promote sustained focus and satiety. 2. Limit processed foods and sugary snacks. Processed foods and sugary snacks often lack essential nutrients and can lead to energy crashes and mood swings. Opt for whole, unprocessed foods whenever possible. Choose fresh fruits and vegetables, lean proteins, whole grains, and healthy fats like avocados, nuts, and seeds. If you have a sweet tooth, opt for natural sweeteners like honey or maple syrup in moderation. 3. Stay hydrated. Dehydration can negatively impact cognitive function and exacerbate ADHD symptoms. Make sure to drink plenty of water throughout the day to stay hydrated. Limit sugary beverages and opt for water, herbal tea, or infused water with fresh fruits for added flavor. 4. Involve the whole family. Creating a supportive environment starts with involving the whole family in healthy eating habits. Encourage everyone to make nutritious choices and model good eating behaviors. Plan and prepare meals together, and involve children in grocery shopping and meal preparation. This not only promotes a balanced diet but also strengthens family bonds. 5. Consider professional guidance. If you're unsure about which dietary changes may be beneficial for you or your child with ADHD, consider seeking guidance from a registered dietitian or healthcare professional specializing in ADHD. They can provide personalized recommendations based on individual needs and help you develop a sustainable and enjoyable eating plan. Remember, nutrition is just one piece of the puzzle when it comes to managing ADHD. It's essential to combine a balanced diet with other strategies such as medication, therapy, and lifestyle modifications for optimal symptom management. By making informed food choices and adopting healthy eating habits, you can support your overall well-being and enhance your ability to focus and thrive with ADHD. 8.3 Exercise and physical activity. Exercise and physical activity play a crucial role in managing ADHD symptoms and promoting overall well-being. Engaging in regular physical activity can have a positive impact on attention, focus, impulse control, and mood. In this section, we will explore the benefits of exercise for individuals with ADHD and provide practical strategies for incorporating physical activity into your daily routine. The benefits of exercise for ADHD. Exercise offers a wide range of benefits for individuals with ADHD. Here are some of the ways in which physical activity can positively impact ADHD symptoms. 1. Improved focus and attention. Engaging in exercise increases the production of neurotransmitters such as dopamine, norepinephrine, and serotonin, which are essential for regulating attention and focus. Regular physical activity can help individuals with ADHD improve their ability to concentrate and stay on task. 2. Reduced hyperactivity and impulsivity. Exercise provides an outlet for excess energy and can help reduce hyperactivity and impulsivity. By engaging in physical activity, individuals with ADHD can channel their energy in productive ways, leading to a calmer and more focused state of mind. 3. Enhanced executive functioning. Executive functioning skills, such as planning, organizing, and problem solving, are often impaired in individuals with ADHD. Regular exercise has been shown to improve these cognitive functions, leading to better overall executive functioning. 4. Mood regulation. Exercise has a positive impact on mood and can help alleviate symptoms of anxiety and depression, which often coexist with ADHD. Physical activity stimulates the release of endorphins, which are natural mood enhancers, promoting a sense of well-being and reducing stress. 5. Better sleep quality. Individuals with ADHD often struggle with sleep difficulties. Engaging in regular exercise can help regulate sleep patterns and improve the quality of sleep. By promoting better sleep, exercise can contribute to increased focus and attention during the day. Strategies for incorporating exercise into your routine. Finding the motivation and consistency to engage in regular exercise can be challenging, especially for individuals with ADHD. However, with the right strategies and mindset, it is possible to make physical activity a regular part of your routine. Here are some practical tips to help you incorporate exercise into your daily life. 1. Choose activities you enjoy. Find physical activities that you genuinely enjoy. Whether it's swimming, dancing, hiking, or playing a team sport, engaging in activities that you find fun and exciting will increase your motivation to stick with them. Experiment with different activities until you find what resonates with you. 2. Set realistic goals. Start small and set realistic goals for yourself. Begin with shorter exercise sessions and gradually increase the duration and intensity as you build your stamina. Setting achievable goals will help you stay motivated and avoid feelings of overwhelm. 3. Create a routine. Establish a consistent exercise routine by scheduling specific times for physical activity. Treat exercise as a non-negotiable part of your day, just like any other important task. Having a set routine will make it easier to stick with your exercise regimen. 4. Make it social. Consider engaging in physical activities with others. Join a sports team, take a group fitness class, or find a workout buddy. Exercising with others can make the experience more enjoyable and provide a sense of accountability and support. 5. Break it up. If finding long stretches of time for exercise is challenging, break your physical activity into shorter, more manageable sessions throughout the day. Even brief bursts of exercise can have a positive impact on your focus and energy levels. 6. Incorporate movement into daily life. Look for opportunities to incorporate movement into your daily routine. Take the stairs instead of the elevator, walk or bike to nearby destinations, or engage in active chores such as gardening or cleaning. These small changes can add up and contribute to your overall physical activity level. 7. Use exercise as a transition tool. Use exercise as a transition tool to help shift your focus and energy levels. Before starting a task that requires concentration, engage in a short burst of physical activity to help clear your mind and increase alertness. 8. Explore mind-body activities. Mind-body activities such as yoga, tai chi, and qigong can be particularly beneficial for individuals with ADHD. These practices combine physical movement with mindfulness and can help improve focus, reduce stress, and promote overall well-being. Remember, the goal is to find physical activities that you enjoy and that fit into your lifestyle. Experiment with different options and be open to trying new things. By making exercise a regular part of your routine, you can harness its powerful benefits in managing ADHD symptoms and improving your overall quality of life. 8.4 Stress Management Techniques. Living with ADHD can often be accompanied by high levels of stress. The challenges of managing symptoms, meeting expectations, and navigating daily life can all contribute to feelings of overwhelm and anxiety. However, by implementing effective stress management techniques, individuals with ADHD can learn to better cope with stress and improve their overall well-being. In this section, we will explore various strategies and techniques that can help in managing stress and promoting a calmer and more balanced life. Understanding stress and ADHD. Stress is a natural response to demanding situations, and individuals with ADHD may be more susceptible to experiencing stress due to the unique challenges they face. The difficulties in managing time, staying organized, and maintaining focus can lead to increased stress levels. Additionally, the constant need to compensate for executive functioning deficits can be mentally and emotionally draining. It is important to recognize the signs of stress in order to effectively manage it. Common symptoms of stress include irritability, restlessness, difficulty concentrating, racing thoughts, physical tension, and changes in appetite or sleep patterns. By being aware of these signs, individuals with ADHD can take proactive steps to reduce stress and prevent it from escalating. Stress management techniques. Exercise. Engaging in regular physical activity is one of the most effective ways to reduce stress. Exercise releases endorphins, which are natural mood boosters, and helps to alleviate tension and anxiety. Find an exercise routine that you enjoy, whether it's going for a walk, practicing yoga, or participating in a team sport. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Mindfulness and meditation. Mindfulness and meditation practices can help individuals with ADHD cultivate a sense of calm and focus. These techniques involve paying attention to the present moment without judgment. By practicing mindfulness, individuals can learn to observe their thoughts and emotions without becoming overwhelmed by them. Consider incorporating mindfulness exercises or guided meditation into your daily routine. Deep breathing. Deep breathing exercises are simple yet powerful tools for reducing stress. When we are stressed, our breathing tends to become shallow and rapid. By consciously slowing down and deepening our breaths, we can activate the body's relaxation response. Take a few minutes each day to practice deep breathing exercises, inhaling deeply through your nose and exhaling slowly through your mouth. Time management. Poor time management can contribute to feelings of stress and overwhelm. By implementing effective time management strategies, individuals with ADHD can better prioritize tasks, set realistic goals, and reduce the likelihood of feeling overwhelmed. Use tools such as calendars, to-do lists, and reminders to help you stay organized and on track. Self-care. Taking care of yourself is crucial for managing stress. Make sure to prioritize self-care activities that bring you joy and relaxation. This could include engaging in hobbies, spending time in nature, practicing self-reflection, or pampering yourself with a bath or massage. Remember that self-care is not selfish, it is essential for your overall well-being. Social support. Building a strong support network can provide a valuable source of emotional support and understanding. Surround yourself with people who are supportive and non-judgmental. Share your experiences with trusted friends, family members, or support groups who can offer guidance and encouragement. Sometimes, simply talking about your stressors can help alleviate the burden. Cognitive behavioral techniques. Cognitive behavioral techniques can help individuals with ADHD reframe negative thoughts and develop healthier coping mechanisms. By challenging negative thinking patterns and replacing them with more positive and realistic thoughts, individuals can reduce stress and improve their overall outlook. Consider seeking therapy or counseling to learn these techniques from a trained professional. Relaxation techniques. Incorporating relaxation techniques into your daily routine can help reduce stress levels. These techniques include progressive muscle relaxation, guided imagery, and aromatherapy. Experiment with different relaxation techniques to find what works best for you and make it a regular part of your self-care routine. Limiting stimulants. Stimulants such as caffeine and nicotine can exacerbate symptoms of anxiety and stress. Limit your intake of these substances, especially in the evening, as they can interfere with sleep and contribute to feelings of restlessness. Seeking professional help. If stress becomes overwhelming and begins to significantly impact your daily life, it may be beneficial to seek professional help. A mental health professional experienced in working with individuals with ADHD can provide guidance, support, and additional strategies for managing stress. Remember, managing stress is an ongoing process, and what works for one person may not work for another. It is important to experiment with different techniques and find a combination that suits your individual needs. By implementing effective stress management techniques, individuals with ADHD can reduce stress levels, improve overall well-being, and enhance their ability to focus and thrive. 9. Improving academic performance. 9.1 Effective study strategies. When it comes to managing ADHD, one of the most important areas to focus on is academic performance. Many individuals with ADHD struggle with studying and retaining information, which can lead to frustration and poor grades. However, with the right strategies and techniques, it is possible to improve study skills and achieve academic success. In this section, we will explore effective study strategies specifically tailored for individuals with ADHD. Breaking down the material. One of the key challenges for individuals with ADHD is processing and retaining large amounts of information. To overcome this, it is essential to break down the material into smaller, more manageable chunks. Instead of trying to study an entire chapter or topic at once, divide it into smaller sections or subtopics. This approach allows for better focus and comprehension. Utilizing visual aids. Visual aids can be incredibly helpful for individuals with ADHD, as they provide a visual representation of the information being studied. Consider using diagrams, charts, graphs, or flashcards to help organize and remember key concepts. Color coding can also be beneficial in categorizing and connecting related information. Active learning techniques. Engaging in active learning techniques can significantly enhance the study experience for individuals with ADHD. Instead of passively reading or listening to information, try incorporating interactive methods such as summarizing the material in your own words, teaching the information to someone else, creating mnemonics or acronyms to remember key points, participating in group discussions or study groups, using hands-on activities or experiments to reinforce concepts. By actively engaging with the material, you are more likely to retain information and improve understanding. Creating a structured study routine. Establishing a structured study routine is crucial for individuals with ADHD. Consistency and predictability help to minimize distractions and create a conducive learning environment. Set aside specific times each day for studying, and try to stick to a regular schedule. Additionally, create a designated study space that is free from distractions and has all the necessary materials readily available. Utilizing multisensory learning. Multisensory learning involves engaging multiple senses simultaneously to enhance learning and memory. This approach can be particularly beneficial for individuals with ADHD, as it helps to maintain focus and improve retention. Some examples of multisensory learning techniques include reading aloud while highlighting key points, using tactile materials, such as manipulatives or textured objects, to reinforce concepts, watching educational videos or listening to podcasts related to the topic, incorporating movement or physical activity while studying, such as pacing or using a standing desk. By incorporating different senses into the learning process, you can make studying more engaging and effective. Implementing time management strategies. Time management is a critical skill for individuals with ADHD, especially when it comes to studying. Here are some strategies to help manage time effectively. Break study sessions into shorter, focused intervals. For example, study for 25 minutes and then take a 5-minute break. Use timers or alarms to stay on track and avoid getting lost in distractions. Prioritize tasks and create a to-do list to ensure important topics are covered first. Set realistic goals and reward yourself for completing them. By implementing these time management strategies, you can make the most of your study time and stay organized. Minimizing distractions. Distractions can significantly hinder studying for individuals with ADHD. It is essential to create an environment that minimizes potential distractions. Here are some tips. Turn off or silence electronic devices to avoid interruptions from notifications. Find a quiet and secluded study space where you can focus without disruptions. Use noise-canceling headphones or play background music specifically designed for concentration, such as instrumental or classical music. Consider using apps or browser extensions that block distracting websites or limit screen time. By minimizing distractions, you can maintain better focus and concentration during study sessions. Seeking support. Lastly, don't hesitate to seek support when needed. Reach out to teachers, tutors, or classmates for clarification or additional resources. Consider joining study groups or seeking assistance from academic support services. Having a support system can provide valuable guidance and motivation throughout your academic journey. Remember, everyone's study preferences and techniques may vary. Experiment with different strategies to find what works best for you. With persistence and the right approach, individuals with ADHD can develop effective study skills and achieve academic success. 9.2 Organizational skills for school. One of the key challenges that individuals with ADHD face in an academic setting is staying organized. Poor organizational skills can lead to missed assignments, forgotten deadlines, and a general sense of overwhelm. However, with the right strategies and tools, it is possible to develop effective organizational skills that can greatly improve academic performance. In this section, we will explore various techniques and tips to help individuals with ADHD stay organized in school. 1. Use a planner or digital calendar. One of the most effective ways to stay organized is to use a planner or a digital calendar. This allows you to keep track of important dates, deadlines, and assignments. When using a planner, make sure to write down all your assignments, tests, and projects as soon as they are assigned. Set reminders on your digital calendar to ensure that you don't forget important tasks. Regularly review your planner or calendar to stay on top of your schedule and make adjustments as needed. 2. Break down tasks. Large tasks can often feel overwhelming, leading to procrastination and poor time management. To overcome this, break down larger tasks into smaller, more manageable steps. For example, if you have a research paper to write, break it down into tasks such as researching, outlining, writing the introduction, and so on. By breaking tasks into smaller chunks, you can tackle them one at a time, making the overall task feel less daunting. 3. Prioritize tasks. Not all tasks are created equal, and it's important to prioritize your assignments and tasks based on their importance and deadlines. Start by identifying the most urgent and important tasks and tackle those first. This will help you stay focused and ensure that you complete your assignments on time. Consider using a color-coded system or numbering system to visually prioritize your tasks. 4. Create a study schedule. Establishing a consistent study schedule can greatly improve your organizational skills and help you manage your time effectively. Set aside specific blocks of time each day for studying and completing assignments. This will not only help you stay on track but also create a routine that can enhance your focus and productivity. Be sure to include breaks in your study schedule to prevent burnout and maintain your energy levels. 5. Use visual aids. Visual aids can be powerful tools for individuals with ADHD to stay organized. Consider using a whiteboard or a bulletin board to display important information such as assignment due dates, upcoming tests, and project deadlines. You can also use sticky notes or color-coded labels to visually categorize and prioritize tasks. Visual aids provide a constant reminder of what needs to be done and can help you stay focused and organized. 6. Keep a clean and organized workspace. A cluttered and disorganized workspace can be a major distraction and hinder your ability to stay organized. Take the time to declutter your desk or study area and create an organized workspace. Have designated spaces for different materials such as textbooks, notebooks, and supplies. Use folders or binders to keep your papers and assignments organized. A clean and organized workspace can help you stay focused and minimize distractions. 7. Utilize technology tools. In today's digital age, there are numerous technology tools available that can assist individuals with ADHD in staying organized. Consider using apps or software specifically designed for task management and organization. These tools can help you create to-do lists, set reminders, and track your progress. Some popular options include Todoist, Trello, and Evernote. Experiment with different tools to find the ones that work best for you. 8. Seek support from teachers and peers. Don't hesitate to reach out for support from your teachers and peers. Inform your teachers about your ADHD and discuss any accommodations or strategies that can help you stay organized. They may be able to provide additional resources or suggestions tailored to your needs. Additionally, consider forming study groups or finding a study buddy who can help keep you accountable and provide support. 9. Develop time management skills. Effective time management is crucial for staying organized in school. Set realistic deadlines for yourself and allocate sufficient time for each task. Avoid procrastination by breaking tasks into smaller steps and starting early. Use timers or alarms to help you stay on track and manage your time effectively. Regularly evaluate and adjust your time management strategies to find what works best for you. 10. Review and reflect. Regularly review and reflect on your organizational strategies to identify what is working and what needs improvement. Take the time to evaluate your progress and make adjustments as needed. Be patient with yourself and remember that developing organizational skills takes time and practice. Celebrate your successes and learn from any setbacks or challenges you encounter. By implementing these organizational strategies, individuals with ADHD can greatly improve their ability to stay organized in school. Remember that everyone is different, so it may take some trial and error to find the strategies that work best for you. Stay persistent, seek support when needed, and embrace the process of developing effective organizational skills. With time and practice, you can overcome the challenges of ADHD and thrive academically. 9.3 Working with teachers and school staff. One of the key factors in managing ADHD in an academic setting is establishing a strong partnership between parents, students, and teachers. Collaboration and open communication with teachers and school staff can greatly contribute to the success of students with ADHD. By working together, it becomes possible to create an environment that supports the unique needs of these students and maximizes their learning potential. In this section, we will explore strategies for effectively working with teachers and school staff to ensure the best possible educational experience for students with ADHD. Understanding ADHD in the classroom. Before approaching teachers and school staff, it is important to ensure that they have a good understanding of ADHD and its impact on learning. Many teachers may already have experience working with students with ADHD, but it is still essential to provide them with relevant information and resources. This can include sharing educational materials, articles, or books that explain the characteristics of ADHD and its implications in the classroom. Additionally, it can be helpful to schedule a meeting with the teacher at the beginning of the school year or semester to discuss your child's specific needs. This meeting can serve as an opportunity to provide information about your child's ADHD diagnosis, any relevant accommodations or strategies that have been effective in the past, and to address any concerns or questions the teacher may have. Open and ongoing communication. Maintaining open lines of communication with teachers and school staff is crucial for addressing any challenges or concerns that may arise throughout the school year. Regular check-ins, either in person, via email, or through a communication platform, can help keep everyone informed and ensure that any necessary adjustments are made promptly. It is important to remember that teachers are often juggling multiple responsibilities and may not always be aware of every issue your child is facing. By proactively reaching out and sharing updates on your child's progress or any changes in their needs, you can help ensure that the teacher is well informed and can provide appropriate support. Collaborating on accommodations and strategies. Collaboration between parents, teachers, and school staff is essential for identifying and implementing effective accommodations and strategies for students with ADHD. This collaboration can involve discussing and brainstorming potential accommodations that can be put in place to support your child's learning and attention needs. Some common accommodations for students with ADHD may include preferential seating near the front of the classroom, providing written instructions in addition to verbal instructions, breaking down tasks into smaller, more manageable steps, and allowing for movement breaks during class. It is important to approach these discussions with a solution-oriented mindset and be open to suggestions from the teacher. Remember that teachers have valuable insights into the dynamics of the classroom and may have strategies that have worked well with other students in the past. Individualized education plans, IEPs, and 504 plans. For students with more significant academic challenges related to their ADHD, an individualized education plan, IEP, or a 504 plan may be appropriate. These plans outline specific accommodations, modifications, and support services that will be provided to the student to ensure their educational needs are met. To initiate the process of developing an IEP or a 504 plan, it is important to communicate with the school's special education department or the designated staff responsible for these plans. This typically involves providing documentation of the ADHD diagnosis and any relevant evaluations or assessments. Working collaboratively with the school staff, you will participate in meetings to discuss your child's strengths, challenges, and goals. Together, you will develop a plan that outlines the specific accommodations and support services that will be provided to your child. Monitoring progress and making adjustments. Regularly monitoring your child's progress and evaluating the effectiveness of the accommodations and strategies in place is essential. This can be done through ongoing communication with the teacher, reviewing academic performance, and seeking feedback from your child. If you notice that certain accommodations or strategies are not yielding the desired results, it is important to address this with the teacher and explore alternative options. Remember that what works for one student may not work for another, so it may be necessary to make adjustments and try different approaches until the most effective ones are identified. Building a positive relationship. Building a positive and collaborative relationship with teachers and school staff is crucial for the success of students with ADHD. By fostering a sense of partnership and mutual respect, you can create an environment where everyone is working towards the same goal of supporting your child's academic and personal growth. Expressing appreciation for the efforts made by teachers and school staff can go a long way in strengthening this relationship. Recognize and acknowledge the extra time and attention they invest in understanding and meeting your child's needs. Remember that teachers and school staff are valuable allies in your child's educational journey. By working together, you can create an environment that fosters success, growth, and self-confidence for students with ADHD. 9.4 Advocating for accommodations. Advocating for accommodations is an essential aspect of managing ADHD, especially in academic and workplace settings. Accommodations are adjustments or modifications made to the environment or tasks to support individuals with ADHD in achieving their full potential. These accommodations can help level the playing field and provide individuals with the necessary tools and resources to succeed. In this section, we will explore the importance of advocating for accommodations and provide strategies for effectively advocating for yourself or your loved one with ADHD. Understanding the importance of advocating for accommodations. Advocating for accommodations is crucial because it ensures that individuals with ADHD have equal access to opportunities and resources. It acknowledges that ADHD is a legitimate neurodevelopmental condition that can impact various aspects of life, including learning, work, and social interactions. By advocating for accommodations, you are advocating for your rights and creating an inclusive environment that supports your unique needs. Accommodations can vary depending on the specific challenges you face due to ADHD. In an academic setting, accommodations may include extended time for exams, preferential seating, note-taking assistance, or the use of assistive technology. In the workplace, accommodations can involve flexible work hours, modified job tasks, or the provision of noise-canceling headphones. These accommodations aim to minimize the impact of ADHD symptoms and create an environment that promotes success. Strategies for effective advocacy. Advocating for accommodations can sometimes be challenging, but with the right strategies, you can effectively communicate your needs and secure the support you require. Here are some strategies to consider. 1. Educate yourself. Before advocating for accommodations, it is essential to have a thorough understanding of ADHD and how it affects you personally. Educate yourself about your rights under the law, such as the Americans with Disabilities Act (ADA) in the United States or the Equality Act in the United Kingdom. Familiarize yourself with the specific accommodations that have been proven effective for individuals with ADHD. The more knowledgeable you are, the better equipped you will be to advocate for your needs. 2. Identify your specific needs. Take the time to identify the specific challenges you face due to ADHD and how they impact your academic or work performance. Reflect on the areas where you struggle the most and consider what accommodations would be most beneficial to address those challenges. For example, if you have difficulty with time management, requesting extended deadlines or the use of time management tools may be helpful. By clearly articulating your needs, you can effectively advocate for the accommodations that will support your success. 3. Communicate openly and clearly. When advocating for accommodations, it is crucial to communicate openly and clearly with the relevant individuals, such as teachers, professors, employers, or human resources personnel. Schedule a meeting or send an email to discuss your ADHD diagnosis, the challenges you face, and the accommodations you are requesting. Clearly explain how these accommodations will help you overcome your difficulties and perform at your best. Use specific examples to illustrate the impact of ADHD on your daily life and emphasize the positive outcomes that accommodations can bring. 4. Provide documentation. In some cases, providing documentation of your ADHD diagnosis may be necessary to support your request for accommodations. This documentation can come from a healthcare professional, such as a psychiatrist or psychologist, who has evaluated and diagnosed your ADHD. The documentation should outline the specific symptoms and functional impairments associated with your ADHD and recommend appropriate accommodations. Be sure to follow any guidelines or requirements set by your academic institution or workplace regarding documentation. 5. Collaborate and problem solve. Approach the process of advocating for accommodations as a collaborative effort. Work together with the relevant individuals to find solutions that meet both your needs and the requirements of the academic or work environment. Be open to suggestions and alternative accommodations that may be offered. Remember that the goal is to create an environment that supports your success, and finding common ground is essential in achieving that. 6. Follow up and evaluate. Once accommodations have been implemented, it is important to follow up and evaluate their effectiveness. Assess whether the accommodations are meeting your needs and if any adjustments or additional accommodations are necessary. Regularly communicate with the relevant individuals to provide feedback and address any concerns or challenges that may arise. By actively participating in the evaluation process, you can ensure that the accommodations continue to support your success. Conclusion. Advocating for accommodations is a vital step in managing ADHD and creating an environment that supports your unique needs. By understanding the importance of advocating for accommodations, identifying your specific needs, and effectively communicating your requirements, you can secure the support necessary to thrive academically and professionally. Remember that advocating for accommodations is not a sign of weakness but rather a demonstration of self-awareness and a commitment to your own success. Embrace your right to equal access and create a path that allows you to reach your full potential. 10. Enhancing social skills. 10.1 Understanding social challenges. Living with ADHD can present unique social challenges that can impact various aspects of your life, including relationships, communication, and social interactions. It is important to understand these challenges and develop strategies to navigate them effectively. In this section, we will explore the social difficulties commonly experienced by individuals with ADHD and provide practical tips for improving social skills. The impact of ADHD on social interactions. ADHD can significantly affect social interactions due to difficulties with attention, impulsivity, and hyperactivity. These challenges can make it harder to engage in effective communication, maintain relationships, and navigate social situations. Here are some common social challenges faced by individuals with ADHD. Inattentiveness. People with ADHD may struggle to pay attention during conversations, leading to missed cues, misunderstandings, and difficulty following social norms. They may appear disinterested or distracted, which can negatively impact their relationships. Impulsivity. Impulsivity can cause individuals with ADHD to interrupt others, speak without thinking, or engage in impulsive behaviors that may be socially inappropriate. This can strain relationships and make it difficult to establish and maintain connections with others. Hyperactivity. Restlessness and hyperactivity can make it challenging for individuals with ADHD to engage in calm and focused social interactions. They may struggle to sit still, have difficulty waiting their turn, or exhibit excessive energy that can be overwhelming for others. Social cues and nonverbal communication. Difficulties with reading social cues and nonverbal communication can make it hard for individuals with ADHD to understand others' emotions, intentions, and social expectations. This can lead to misinterpretations, misunderstandings, and difficulties in building rapport with others. Executive functioning deficits. Executive functioning deficits, such as poor planning, organization, and time management skills, can impact social interactions. Individuals with ADHD may struggle to initiate and maintain social plans, remember important dates or commitments, and follow through on social obligations. Strategies for improving social skills. While social challenges can be daunting, there are strategies and techniques that can help individuals with ADHD improve their social skills and navigate social situations more effectively. Here are some practical tips to consider. Active listening. Practice active listening by maintaining eye contact, nodding, and summarizing what the other person is saying. This demonstrates your engagement and understanding, and helps you stay focused on the conversation. Pause before responding. Take a moment to pause and gather your thoughts before responding to others. This can help you avoid impulsive reactions or interrupting, allowing for more thoughtful and effective communication. Practice empathy. Make an effort to understand others' perspectives and emotions. Put yourself in their shoes and consider how they might be feeling. This can help you respond in a more compassionate and understanding manner. Learn social cues. Pay attention to nonverbal cues, such as body language, facial expressions, and tone of voice. Practice recognizing and interpreting these cues to better understand others' emotions and intentions. Develop social scripts. Prepare and practice social scripts for common social situations, such as introductions, small talk, or expressing gratitude. Having a script can provide a framework for navigating social interactions more confidently. Seek feedback. Ask trusted friends or family members for feedback on your social skills. They can provide valuable insights and suggestions for improvement. Be open to constructive criticism and use it as an opportunity for growth. Join support groups. Consider joining support groups or social skills training programs specifically designed for individuals with ADHD. These groups provide a safe and supportive environment to practice social skills and learn from others who share similar experiences. Take breaks when needed. If you find yourself becoming overwhelmed or overstimulated in social situations, give yourself permission to take breaks. Excuse yourself for a few minutes to recharge and regain focus before rejoining the conversation. Practice self-care. Prioritize self-care activities that help reduce stress and improve overall well-being. Engaging in regular exercise, getting enough sleep, and managing stress can positively impact your social interactions and overall social functioning. Seek professional help. If social challenges significantly impact your daily life and relationships, consider seeking professional help from a therapist or counselor who specializes in ADHD. They can provide guidance, support, and specific strategies tailored to your unique needs. Remember, improving social skills takes time and practice. Be patient with yourself and celebrate small victories along the way. With dedication and perseverance, you can develop effective social skills and build meaningful connections with others. 10.2 Improving communication skills. Effective communication is a vital skill in all aspects of life, and it becomes even more crucial for individuals with ADHD. Difficulties with attention, impulsivity, and hyperactivity can often impact communication, leading to misunderstandings, frustration, and strained relationships. However, by developing and honing communication skills, individuals with ADHD can improve their ability to express themselves, understand others, and build stronger connections with those around them. The importance of communication skills. Communication is the foundation of human interaction. It allows us to convey our thoughts, feelings, and needs, as well as understand and empathize with others. For individuals with ADHD, challenges in communication can arise due to various factors, including Inattentiveness. Difficulty maintaining focus during conversations can lead to missed information or misinterpretation of messages. Impulsivity. Impulsive responses or interruptions can disrupt the flow of communication and hinder effective understanding. Hyperactivity. Restlessness and excessive movement can make it challenging to engage in active listening and maintain eye contact. Poor social skills. Difficulties with social cues and nonverbal communication can impact the ability to connect with others. Improving communication skills can help individuals with ADHD overcome these challenges and enhance their relationships, both personally and professionally. Active listening. Active listening is a fundamental aspect of effective communication. It involves fully engaging with the speaker, paying attention to both verbal and nonverbal cues, and demonstrating understanding. Here are some strategies to improve active listening skills. Maintain eye contact. Making eye contact with the speaker shows that you are attentive and interested in what they have to say. Minimize distractions. Find a quiet and calm environment to have conversations, away from potential distractions such as electronic devices or noisy surroundings. Paraphrase and summarize. Repeat or rephrase what the speaker has said to ensure you have understood their message correctly. Ask clarifying questions. If something is unclear, don't hesitate to ask for clarification. It shows that you are actively engaged in the conversation. Avoid interrupting. Practice patience and refrain from interrupting the speaker. Allow them to finish their thoughts before responding. Nonverbal communication. Nonverbal communication plays a significant role in conveying messages and understanding others. Individuals with ADHD may struggle with interpreting and utilizing nonverbal cues effectively. Here are some tips to improve nonverbal communication skills. Body language. Pay attention to your own body language and try to convey openness and attentiveness. Maintain an upright posture, face the speaker, and use appropriate gestures. Facial expressions. Be mindful of your facial expressions, as they can convey emotions and attitudes. Smile when appropriate and show empathy through your facial expressions. Tone of voice. Modulate your tone of voice to match the message you want to convey. Avoid speaking too loudly or softly, and try to convey enthusiasm or empathy through your voice. Personal space. Respect personal boundaries and be aware of the appropriate distance to maintain during conversations. Invading someone's personal space can make them uncomfortable. Clear and concise communication. Individuals with ADHD may struggle with organizing their thoughts and expressing themselves clearly. However, by practicing clear and concise communication, they can effectively convey their ideas and reduce the chances of miscommunication. Here are some strategies to improve clarity in communication. Organize your thoughts. Take a moment to gather your thoughts before speaking. Jotting down key points or using visual aids can help you stay focused and organized. Use simple language. Avoid using complex or convoluted language. Instead, opt for simple and straightforward words and sentences to ensure your message is easily understood. Be specific. Provide specific details and examples when conveying information or expressing your needs. This helps others understand your perspective more clearly. Ask for feedback. After conveying a message, ask the listener if they understood what you said. This allows you to clarify any misunderstandings and make adjustments if necessary. Empathy and understanding. Developing empathy and understanding is crucial for effective communication. It involves recognizing and acknowledging the emotions and perspectives of others. Here are some tips to enhance empathy and understanding. Practice active empathy. Put yourself in the other person's shoes and try to understand their feelings and experiences. This helps build a connection and fosters better communication. Validate emotions. Acknowledge and validate the emotions expressed by others. Let them know that you understand and empathize with their feelings. Be patient. Practice patience when communicating with others. Allow them to express themselves fully without interrupting or rushing them. Avoid judgment. Suspend judgment and approach conversations with an open mind. This creates a safe space for open and honest communication. Improving communication skills is an ongoing process that requires practice and patience. By implementing these strategies, individuals with ADHD can enhance their ability to express themselves, understand others, and build stronger relationships. Effective communication not only improves personal connections but also contributes to success in academic and professional settings. 10.3 Building and maintaining relationships. Building and maintaining relationships can be challenging for individuals with ADHD. The symptoms of ADHD, such as impulsivity, inattention, and hyperactivity, can often interfere with social interactions and make it difficult to establish and sustain meaningful connections with others. However, with the right strategies and support, individuals with ADHD can develop strong and fulfilling relationships. Understanding the impact of ADHD on relationships. ADHD can have a significant impact on various aspects of relationships, including friendships, romantic partnerships, and family dynamics. Some common challenges that individuals with ADHD may face in their relationships include communication difficulties. People with ADHD may struggle with listening attentively, maintaining focus during conversations, and following through on commitments. This can lead to misunderstandings, frustration, and a breakdown in communication. Impulsivity. Impulsive behaviors, such as interrupting others, speaking without thinking, or acting without considering the consequences, can strain relationships and create tension. Forgetfulness and disorganization. Individuals with ADHD may have difficulty remembering important dates, events, or commitments, which can lead to feelings of neglect or being unimportant to their loved ones. Time management challenges. Poor time management skills can result in lateness, missed appointments, and a lack of reliability, which can strain relationships and erode trust. Emotional dysregulation. ADHD can contribute to emotional sensitivity, mood swings, and difficulty managing frustration or anger. These emotional challenges can impact relationships and make it harder to resolve conflicts effectively. Strategies for building and maintaining relationships. While ADHD can present unique challenges in relationships, there are several strategies that can help individuals with ADHD build and maintain healthy connections with others. Educate yourself and your loved ones. Learn about ADHD and its impact on relationships. Share this knowledge with your loved ones to help them understand your challenges and develop empathy and patience. Practice active listening. Make a conscious effort to listen attentively when others are speaking. Maintain eye contact, ask clarifying questions, and summarize what you've heard to ensure understanding. Develop effective communication skills. Work on improving your communication skills, such as expressing yourself clearly and concisely, using I statements to express your feelings, and actively seeking feedback from others. Manage impulsivity. Practice self-control techniques to manage impulsive behaviors. Take a moment to pause and think before responding or acting, and consider the potential consequences of your actions. Use visual aids and reminders. Utilize tools like calendars, to-do lists, and reminders to help you stay organized and remember important dates and commitments. This can help reduce forgetfulness and improve reliability. Set realistic expectations. Be honest with yourself and others about your strengths and limitations. Set realistic expectations for yourself and communicate them to your loved ones to avoid feelings of disappointment or frustration. Seek support from your loved ones. Share your challenges and goals with your loved ones and ask for their support. Having a strong support network can provide encouragement, understanding, and accountability. Practice self-care. Take care of your physical and mental well-being. Engage in activities that reduce stress, such as exercise, meditation, or hobbies, to help manage ADHD symptoms and improve your overall mood and energy levels. Seek professional help if needed. If you're struggling with relationship difficulties related to ADHD, consider seeking support from a therapist or counselor who specializes in ADHD. They can provide guidance, strategies, and support tailored to your specific needs. Nurturing romantic relationships. Romantic relationships can be particularly challenging for individuals with ADHD due to the increased demands for communication, emotional intimacy, and time management. Here are some additional strategies for nurturing romantic relationships. Open and honest communication. Establish open lines of communication with your partner. Discuss your ADHD symptoms, challenges, and strategies for managing them. Encourage your partner to share their feelings and concerns as well. Quality time together. Make a conscious effort to spend quality time with your partner. Plan activities that you both enjoy and create opportunities for connection and bonding. Shared responsibilities. Divide household chores and responsibilities fairly. Clearly communicate expectations and establish routines to help manage tasks effectively. Practice patience and understanding. Remember that both you and your partner are unique individuals with strengths and weaknesses. Practice patience, empathy, and understanding when conflicts arise. Seek couples therapy. Consider couples therapy as a way to strengthen your relationship and improve communication. A therapist can provide guidance and support in navigating the challenges that ADHD may present in your relationship. Building strong friendships. Friendships can provide vital support and companionship for individuals with ADHD. Here are some strategies for building and maintaining strong friendships. Choose understanding friends. Surround yourself with friends who are understanding, patient, and accepting of your ADHD. Seek out individuals who are willing to learn about ADHD and support you in managing your symptoms. Be open about your ADHD. Share your ADHD diagnosis with your friends if you feel comfortable doing so. Educate them about ADHD and how it may impact your behavior and interactions. Practice active listening and empathy. Show genuine interest in your friends' lives and actively listen to what they have to say. Practice empathy and offer support when they need it. Be reliable and trustworthy. Strive to be reliable and trustworthy in your friendships. Follow through on commitments, be punctual, and be there for your friends when they need you. Engage in shared interests. Participate in activities and hobbies that you enjoy with your friends. Engaging in shared interests can strengthen your bond and provide opportunities for connection. Strengthening family relationships. ADHD can also impact family dynamics. Here are some strategies for strengthening family relationships. Open and honest communication. Foster open and honest communication within your family. Encourage family members to express their feelings and concerns, and actively listen to one another. Establish routines and structure. Create routines and establish clear expectations within your family. Consistency and structure can help individuals with ADHD manage their symptoms and reduce stress. Encourage family support and understanding. Educate your family members about ADHD and its impact on your life. Encourage them to learn about the condition and provide support and understanding. Celebrate strengths and achievements. Focus on the strengths and achievements of each family member, including those with ADHD. Celebrate successes and provide encouragement and support. Seek family therapy if needed. If family relationships are strained due to ADHD-related challenges, consider seeking family therapy. A therapist can help improve communication, resolve conflicts, and strengthen family bonds. Remember, building and maintaining relationships takes time, effort, and patience. By implementing these strategies and seeking support when needed, individuals with ADHD can develop strong and fulfilling connections with others. 10.4 Navigating social situations. Social situations can be challenging for individuals with ADHD. The difficulties in maintaining focus, impulsivity, and hyperactivity can make it harder to navigate social interactions smoothly. However, with the right strategies and support, individuals with ADHD can learn to thrive in social settings. In this section, we will explore some effective techniques for navigating social situations with ADHD. 1. Understanding social cues. One of the key challenges for individuals with ADHD in social situations is understanding and interpreting social cues. It can be difficult to pick up on nonverbal cues such as body language, facial expressions, and tone of voice. This can lead to misunderstandings and miscommunication. To improve your ability to understand social cues, it can be helpful to practice active listening and observation. Pay attention to the speaker's body language, facial expressions, and tone of voice. Try to read between the lines and understand the underlying emotions and intentions. Additionally, seeking feedback from trusted friends or family members can provide valuable insights into how others perceive your social interactions. 2. Developing empathy. Empathy is the ability to understand and share the feelings of others. It plays a crucial role in building and maintaining relationships. Individuals with ADHD may struggle with empathy due to difficulties in focusing on others and regulating their own emotions. To develop empathy, practice putting yourself in other people's shoes. Try to imagine how they might be feeling in a given situation. Actively listen to their concerns and validate their emotions. Engaging in activities that promote empathy, such as volunteering or participating in group discussions, can also help enhance your empathetic skills. 3. Managing impulsivity. Impulsivity can often lead to social blunders and misunderstandings. It's important to learn how to manage impulsive behaviors in social situations. One effective strategy is to pause and take a deep breath before responding. This brief moment of reflection can help you consider the consequences of your actions and choose a more appropriate response. Additionally, practicing active listening can help you avoid interrupting others and allow them to fully express their thoughts and feelings. Taking the time to think before speaking can also help you avoid saying things you may regret later. 4. Practicing social skills. Social skills are like any other skill, so they can be learned and improved with practice. Engaging in social activities and seeking out opportunities to interact with others can help you develop and refine your social skills. Consider joining social clubs or groups that align with your interests. This can provide a structured environment for practicing social interactions and building relationships with like-minded individuals. Additionally, seeking out social skills training programs or working with a therapist can provide valuable guidance and support in developing effective social skills. 5. Setting realistic expectations. It's important to set realistic expectations for yourself in social situations. Understand that socializing can be challenging, and it's okay to make mistakes or feel uncomfortable at times. Accepting yourself and your ADHD as part of who you are can help alleviate the pressure to conform to societal norms. Remember that building social skills takes time and effort. Celebrate small victories and acknowledge your progress along the way. Be patient with yourself and recognize that everyone has their own unique strengths and weaknesses in social situations. 6. Seeking support. Navigating social situations with ADHD can be easier with the support of others. Reach out to friends, family, or support groups who understand and can provide guidance and encouragement. Having a support network can help you feel more confident and less isolated in social settings. Additionally, consider working with a therapist or coach who specializes in ADHD. They can provide personalized strategies and techniques to help you navigate social situations more effectively. Therapy can also provide a safe space to explore and address any underlying emotional challenges that may be impacting your social interactions. Conclusion. Navigating social situations with ADHD may require some additional effort and strategies, but it is entirely possible to thrive in social settings. By understanding social cues, developing empathy, managing impulsivity, practicing social skills, setting realistic expectations, and seeking support, individuals with ADHD can build meaningful relationships and enjoy fulfilling social lives. Remember, your ADHD does not define you, and with the right tools and support, you can navigate social situations with confidence and success. 11. Managing ADHD in the workplace. 11.1 Disclosing ADHD to employers. Disclosing your ADHD diagnosis to your employer can be a difficult decision to make. On one hand, you may worry about potential stigma or discrimination. On the other hand, disclosing your ADHD can help your employer understand your needs and provide necessary accommodations to support your success in the workplace. In this section, we will explore the considerations and steps involved in disclosing ADHD to your employer. Understanding the benefits of disclosure. Before deciding whether to disclose your ADHD to your employer, it is important to understand the potential benefits. By disclosing your diagnosis, you can access accommodations. Disclosing your ADHD allows your employer to provide reasonable accommodations that can help you perform your job more effectively. These accommodations may include flexible work hours, modified workspaces, or assistive technologies. Reduce misunderstandings. By sharing information about your ADHD, you can help your employer understand any challenges you may face in the workplace. This can prevent misunderstandings and improve communication between you and your employer. Promote a supportive environment. Disclosing your ADHD can contribute to creating a more inclusive and supportive work environment. It can help educate your colleagues and supervisors about ADHD and reduce stigma surrounding the condition. Assessing the workplace culture. Before disclosing your ADHD, it is important to assess the workplace culture and consider how your employer may react. Some employers may be supportive and understanding, while others may not have a clear understanding of ADHD or may hold biases. Consider the following factors. Company policies. Review your company's policies regarding disability accommodations and disclosure. Familiarize yourself with any legal protections that may be in place to safeguard your rights as an employee with ADHD. Colleague experiences. Speak with trusted colleagues who have disclosed their disabilities to get a sense of how the company responds to such disclosures. Their experiences can provide valuable insights into the potential reactions and support you may receive. Supervisor relationships. Evaluate your relationship with your immediate supervisor. If you have a positive and open relationship, it may be easier to discuss your ADHD and request accommodations. However, if you have concerns about your supervisor's understanding or support, you may need to approach the situation more cautiously. Preparing for disclosure. Once you have decided to disclose your ADHD, it is important to prepare for the conversation with your employer. Consider the following steps. Gather information. Educate yourself about ADHD and how it may impact your work. Be prepared to explain your specific challenges and how they can be addressed through accommodations. Identify accommodations. Determine the accommodations that would be most beneficial for you in the workplace. Consider your specific needs, such as flexible work hours, noise reduction measures, or written instructions. Choose the right time. Select an appropriate time to discuss your ADHD with your employer. Request a private meeting to ensure confidentiality and allow for a focused conversation. Practice self-advocacy. Develop a clear and concise explanation of your ADHD and its impact on your work. Practice communicating your needs and concerns effectively to ensure a productive conversation. Disclosing ADHD. When disclosing your ADHD to your employer, it is important to approach the conversation with confidence and clarity. Follow these guidelines. Be direct and honest. Clearly state that you have been diagnosed with ADHD and explain how it affects your work performance. Provide specific examples of challenges you have faced and how accommodations can help overcome them. Focus on abilities. Emphasize your strengths and skills while discussing your ADHD. Highlight how accommodations can enhance your productivity and contribute to the overall success of the team. Request accommodations. Clearly articulate the accommodations you believe would be helpful in addressing your ADHD-related challenges. Explain how these accommodations align with your job responsibilities and will enable you to perform at your best. Address concerns. Be prepared to address any concerns or questions your employer may have. Provide information about the effectiveness of accommodations and any potential cost or logistical considerations. Handling potential reactions. When disclosing your ADHD, it is important to be prepared for a range of reactions from your employer. Here are some possible scenarios and strategies for handling them. Supportive response. If your employer responds positively and offers support, express gratitude and work collaboratively to implement the requested accommodations. Maintain open communication to ensure ongoing support. Lack of understanding. If your employer demonstrates a lack of understanding or dismisses your concerns, remain calm and provide additional information about ADHD. Offer resources or suggest involving a disability accommodation specialist to facilitate the conversation. Discrimination or negative response. In the unfortunate event of discrimination or a negative response, consult with a legal professional who specializes in employment law. They can guide you on your rights and potential courses of action. Remember, the decision to disclose your ADHD is personal, and you have the right to choose whether or not to share this information. Consider your own comfort level, the potential benefits, and the specific circumstances of your workplace before making a decision. 11.2 Accommodations and Workplace Support. In the previous section, we discussed the importance of disclosing your ADHD to your employer. Once you have disclosed your condition, it is crucial to explore the various accommodations and workplace support options available to you. These accommodations can help level the playing field and create an environment that allows you to thrive in the workplace. Understanding accommodations. Accommodations are adjustments or modifications made to the work environment or job tasks to enable individuals with ADHD to perform their job duties effectively. These accommodations are designed to address the specific challenges faced by individuals with ADHD and provide them with the necessary support to succeed in the workplace. Accommodations can vary depending on the individual's needs and the nature of their job. Some common accommodations for individuals with ADHD include Flexible work schedule. Many individuals with ADHD find it helpful to have a flexible work schedule that allows them to work during their most productive hours. This flexibility can help them manage their energy levels and optimize their focus and attention. Structured work environment. Creating a structured work environment can be beneficial for individuals with ADHD. This can include clear guidelines, routines, and visual cues to help them stay organized and on track. Task prioritization and time management. Providing support in prioritizing tasks and managing time effectively can be crucial for individuals with ADHD. This can involve breaking down complex projects into smaller, manageable tasks and setting realistic deadlines. Reducing distractions. Minimizing distractions in the workplace can significantly improve focus and productivity for individuals with ADHD. This can be achieved by providing a quiet workspace, using noise-canceling headphones, or implementing policies that limit interruptions. Assistive technology. Utilizing assistive technology tools can be a game changer for individuals with ADHD. These tools can include reminder apps, task management software, and noise-blocking headphones, among others. Supportive supervision. Having a supportive supervisor who understands ADHD and is willing to provide guidance and feedback can make a significant difference. Regular check-ins, clear communication, and constructive feedback can help individuals with ADHD stay on track and feel supported. Requesting accommodations. To request accommodations in the workplace, it is essential to follow the appropriate process outlined by your employer. Here are some steps you can take. Gather information. Educate yourself about your rights and the accommodations available for individuals with ADHD in your country or region. Familiarize yourself with your company's policies and procedures regarding accommodations. Document your needs. Prepare a written document outlining your specific needs and how they relate to your job duties. Be clear and specific about the accommodations you are requesting and how they will enable you to perform your job effectively. Meet with human resources. Schedule a meeting with your company's human resources department to discuss your accommodation request. Provide them with the documentation you have prepared and be prepared to answer any questions they may have. Collaborate with your supervisor. It can be helpful to involve your supervisor in the accommodation process. They can provide valuable insights into your job requirements and help identify appropriate accommodations. Collaborating with your supervisor can also help ensure that the accommodations are implemented effectively. Follow up. After your accommodation request has been submitted, follow up with human resources to ensure that it is being processed. If any additional information or documentation is required, provide it promptly. Workplace support. In addition to accommodations, seeking workplace support can further enhance your success in managing ADHD. Here are some strategies to consider. Educate your colleagues. Consider educating your colleagues about ADHD to foster understanding and create a supportive work environment. This can help reduce stigma and promote empathy and collaboration. Join support groups. Seek out support groups or networks for individuals with ADHD in the workplace. Connecting with others who share similar experiences can provide valuable insights, advice, and emotional support. Utilize coaching or mentoring. Working with a coach or mentor who specializes in ADHD can be highly beneficial. They can provide guidance, strategies, and accountability to help you navigate workplace challenges and maximize your potential. Practice self-care. Prioritize self-care to manage stress and maintain overall well-being. Engage in activities that help you relax and recharge, such as exercise, mindfulness, and hobbies. Remember, managing ADHD in the workplace is a journey, and it may take time to find the accommodations and support that work best for you. Be patient with yourself and advocate for your needs. With the right accommodations and support, you can thrive in your career and achieve your goals. 11.3 Time Management Strategies. Time management is a crucial skill for individuals with ADHD. The ability to effectively manage time can help individuals with ADHD stay organized, meet deadlines, and reduce stress. In this section, we will explore various time management strategies that can be beneficial for individuals with ADHD. Prioritize tasks. One of the first steps in effective time management is prioritizing tasks. Individuals with ADHD often struggle with determining which tasks are most important and tend to get overwhelmed by a long to-do list. To overcome this challenge, it can be helpful to break down tasks into smaller, more manageable steps and prioritize them based on urgency and importance. One effective method for prioritizing tasks is using the Eisenhower matrix. This matrix categorizes tasks into 4 quadrants: urgent and important, important but not urgent, urgent but not important, and neither urgent nor important. By categorizing tasks in this way, individuals with ADHD can focus their attention on the most critical tasks and allocate their time accordingly. Set realistic goals and deadlines. Setting realistic goals and deadlines is essential for effective time management. Individuals with ADHD often struggle with estimating how long tasks will take, leading to poor time allocation and increased stress. To overcome this challenge, it can be helpful to break down larger tasks into smaller, more manageable chunks and assign specific deadlines to each chunk. It is important to set realistic goals that take into account the individual's ADHD symptoms and potential challenges. By setting achievable goals and deadlines, individuals with ADHD can experience a sense of accomplishment and stay motivated to continue their work. Use visual tools and reminders. Visual tools and reminders can be powerful aids for individuals with ADHD in managing their time. Visual tools, such as calendars, planners, and to-do lists, can help individuals with ADHD visualize their tasks and deadlines. These tools can be particularly effective when combined with color coding or other visual cues to enhance organization and clarity. In addition to visual tools, reminders can be set on smartphones, computers, or other devices to prompt individuals with ADHD to start or complete specific tasks. These reminders can be particularly helpful for individuals who struggle with time perception and tend to lose track of time easily. Break tasks into manageable chunks. Breaking tasks into manageable chunks is a valuable strategy for individuals with ADHD. Large tasks can feel overwhelming and lead to procrastination or avoidance. By breaking tasks into smaller, more manageable chunks, individuals with ADHD can approach their work in a more systematic and organized manner. One effective technique for breaking tasks into manageable chunks is the Pomodoro technique. This technique involves breaking work into 25-minute intervals, called Pomodoros, with short breaks in between. After completing 4 Pomodoros, a longer break is taken. This technique helps individuals with ADHD maintain focus and productivity by providing structured work periods and regular breaks. Minimize distractions. Distractions can significantly impact time management for individuals with ADHD. It is important to create an environment that minimizes distractions and promotes focus. This can be achieved by designating a specific workspace. Having a dedicated workspace can help individuals with ADHD associate that space with work and minimize distractions. Removing unnecessary distractions. Keeping electronic devices on silent mode, closing irrelevant tabs or applications on the computer, and minimizing visual clutter can help reduce distractions. Using noise-canceling headphones. For individuals who are easily distracted by noise, using noise-canceling headphones or playing background music can help create a more focused environment. Practice time blocking. Time blocking is a time management technique that involves scheduling specific blocks of time for different tasks or activities. This technique can be particularly helpful for individuals with ADHD as it provides structure and helps prevent time from slipping away. To practice time blocking, individuals with ADHD can allocate specific time slots for different tasks or activities throughout the day. This can include work-related tasks, breaks, exercise, and leisure activities. By assigning specific time blocks to each task, individuals with ADHD can better manage their time and ensure that important tasks are not overlooked. Use technology and apps. Technology and apps can be valuable tools for individuals with ADHD in managing their time. There are numerous apps available that can help with task management, time tracking, reminders, and organization. Some popular apps include Todoist, Trello, Google Calendar, and Evernote. These apps can provide individuals with ADHD with visual reminders, notifications, and organizational features that can enhance time management skills. It is important to explore different apps and find the ones that best suit individual needs and preferences. Seek support and accountability. Seeking support and accountability can be beneficial for individuals with ADHD in managing their time effectively. This can involve enlisting the help of a friend, family member, or colleague to provide support and encouragement. Sharing goals and progress with someone else can help individuals with ADHD stay motivated and accountable. Additionally, joining support groups or seeking professional help, such as working with a coach or therapist specializing in ADHD, can provide individuals with ADHD with valuable strategies and guidance in managing their time. In conclusion, effective time management is crucial for individuals with ADHD to stay organized, meet deadlines, and reduce stress. By prioritizing tasks, setting realistic goals and deadlines, using visual tools and reminders, breaking tasks into manageable chunks, minimizing distractions, practicing time blocking, utilizing technology and apps, and seeking support and accountability, individuals with ADHD can improve their time management skills and enhance their overall productivity and well-being. 11.4 Managing workload and priorities. Managing workload and priorities can be particularly challenging for individuals with ADHD. The difficulty in organizing tasks, prioritizing responsibilities, and staying focused can often lead to feelings of overwhelm and stress. However, with the right strategies and techniques, it is possible to effectively manage workload and priorities, allowing individuals with ADHD to thrive in the workplace. Breaking down tasks. One of the first steps in managing workload and priorities is breaking down tasks into smaller, more manageable steps. This approach helps to prevent feelings of overwhelm and allows for better focus and concentration. When faced with a large project or assignment, it can be helpful to create a to-do list and break it down into smaller, actionable tasks. By tackling one task at a time, individuals with ADHD can maintain focus and make progress towards completing the overall project. Prioritizing tasks. Once tasks have been broken down, it is important to prioritize them based on their importance and deadline. Prioritizing tasks helps individuals with ADHD stay organized and ensures that the most critical tasks are completed first. One effective method for prioritizing tasks is using the Eisenhower matrix, which categorizes tasks into 4 quadrants: urgent and important, important but not urgent not important, and not urgent or important. By categorizing tasks in this way, individuals can focus their attention on the most important and time-sensitive tasks. Time blocking. Time blocking is a valuable technique for individuals with ADHD to manage their workload and priorities effectively. This method involves scheduling specific blocks of time for different tasks or activities. By allocating dedicated time slots for specific tasks, individuals can create a structured routine and minimize distractions. It is important to consider individual attention spans and energy levels when time blocking. For example, if someone tends to have higher energy levels in the morning, they may want to schedule more challenging or demanding tasks during that time. Setting realistic deadlines. Setting realistic deadlines is crucial for individuals with ADHD to manage their workload effectively. It is important to consider the time required for each task and allow for potential distractions or unforeseen circumstances. Setting overly ambitious deadlines can lead to increased stress and a higher likelihood of procrastination. By setting realistic deadlines, individuals can better manage their workload and reduce the risk of feeling overwhelmed. Utilizing technology and tools. In today's digital age, there are numerous technological tools and apps available to assist individuals with ADHD in managing their workload and priorities. These tools can help with task management, time tracking, and reminders. For example, project management apps like Trello or Asana can help individuals organize and track their tasks, while time tracking apps like Toggle or Rescue Time can provide insights into how time is being spent. Additionally, setting reminders and utilizing calendar apps can help individuals stay on top of deadlines and appointments. Seeking support and collaboration. Seeking support and collaboration can be beneficial for individuals with ADHD in managing their workload and priorities. Communicating with supervisors, colleagues, or team members about workload and deadlines can help ensure that expectations are clear and manageable. Additionally, collaborating with others on projects or tasks can help distribute the workload and provide opportunities for brainstorming and problem solving. By seeking support and collaborating with others, individuals with ADHD can alleviate some of the pressure and stress associated with managing their workload. Managing distractions. Distractions can significantly impact productivity and the ability to manage workload and priorities. Individuals with ADHD may be more susceptible to distractions, making it important to implement strategies to minimize their impact. Some effective strategies include creating a dedicated workspace, turning off notifications on electronic devices, and using noise-canceling headphones. Additionally, practicing mindfulness techniques, such as deep breathing or meditation, can help individuals refocus their attention when distractions arise. Taking breaks. Taking regular breaks is essential for individuals with ADHD to maintain focus and productivity. Breaks provide an opportunity to recharge and prevent mental fatigue. It is important to schedule short breaks throughout the day and engage in activities that promote relaxation and rejuvenation. Taking a walk, practicing stretching exercises, or engaging in a hobby can help clear the mind and improve overall productivity. Reflecting and adjusting. Managing workload and priorities is an ongoing process that requires reflection and adjustment. It is important for individuals with ADHD to regularly assess their strategies and techniques to determine what is working and what needs to be modified. Reflecting on past experiences and identifying areas for improvement can help individuals refine their approach and optimize their productivity. Additionally, seeking feedback from supervisors or colleagues can provide valuable insights and suggestions for managing workload more effectively. In conclusion, managing workload and priorities can be challenging for individuals with ADHD, but with the right strategies and techniques, it is possible to overcome these challenges. Breaking down tasks, prioritizing responsibilities, time blocking, and utilizing technology are all effective methods for managing workload. Seeking support, managing distractions, taking breaks, and reflecting on strategies are also important aspects of effectively managing workload and priorities. By implementing these strategies, individuals with ADHD can enhance their productivity, reduce stress, and thrive in the workplace. 12. Thriving with ADHD. 12.1 Building self-confidence. Building self-confidence is an essential aspect of managing ADHD. When individuals with ADHD struggle with focus, impulsivity, and hyperactivity, it can often lead to feelings of frustration, inadequacy, and low self-esteem. However, by actively working on building self-confidence, individuals with ADHD can develop a positive mindset, improve their self-image, and thrive in various aspects of their lives. Understanding the impact of ADHD on self-confidence. ADHD can significantly impact self-confidence due to the challenges it presents in daily life. Individuals with ADHD may struggle with completing tasks, meeting deadlines, and maintaining focus, which can lead to feelings of incompetence and self-doubt. Additionally, the negative feedback and criticism they may receive from others can further erode their self-confidence. It is important to recognize that ADHD is not a reflection of intelligence or capability. ADHD is a neurodevelopmental disorder that affects the brain's executive functions, such as attention, impulse control, and organization. By understanding the impact of ADHD on self-confidence, individuals can begin to separate their self-worth from their ADHD symptoms. Celebrating strengths and accomplishments. One effective way to build self-confidence is to focus on strengths and accomplishments. Individuals with ADHD often possess unique strengths such as creativity, problem-solving abilities, and high energy levels. By recognizing and celebrating these strengths, individuals can develop a positive self-image and boost their confidence. It is essential to acknowledge and appreciate personal achievements, no matter how small they may seem. Setting realistic goals and working towards them can provide a sense of accomplishment and reinforce self-confidence. By breaking tasks into smaller, manageable steps, individuals can experience success and build momentum, leading to increased self-confidence. Developing coping strategies. Developing effective coping strategies is crucial for managing ADHD and building self-confidence. By learning and implementing strategies to manage symptoms and challenges, individuals can gain a sense of control over their lives. Coping strategies can include techniques such as creating routines, using visual aids, setting reminders, and utilizing organizational tools. When individuals with ADHD have strategies in place to manage their symptoms, they are better equipped to navigate daily tasks and responsibilities. This sense of control and mastery can significantly boost self-confidence. It is important to experiment with different strategies and find what works best for each individual. Seeking support and building a support network. Seeking support from others who understand and empathize with the challenges of ADHD can be immensely beneficial for building self-confidence. Support groups, therapy, and counseling can provide a safe space to share experiences, gain insights, and receive encouragement. Connecting with others who have similar experiences can help individuals realize that they are not alone in their struggles. Building a support network of family, friends, and mentors who are understanding and supportive can also contribute to increased self-confidence. Surrounding oneself with positive influences and individuals who believe in their abilities can provide a strong foundation for building self-confidence. Practicing self-care and mindfulness. Self-care and mindfulness practices play a vital role in building self-confidence for individuals with ADHD. Taking care of physical and mental well-being is essential for overall confidence and resilience. Engaging in activities that bring joy, relaxation, and fulfillment can help individuals feel more positive and confident. Practicing mindfulness, such as meditation or deep breathing exercises, can help individuals with ADHD manage stress, improve focus, and increase self-awareness. Mindfulness allows individuals to observe their thoughts and emotions without judgment, fostering self-acceptance and self-compassion. Challenging negative self-talk. Negative self-talk can be a significant barrier to building self-confidence. Individuals with ADHD may internalize negative beliefs about themselves due to past failures or criticism. Challenging and reframing negative self-talk is crucial for developing a positive self-image. By consciously replacing negative thoughts with positive and realistic affirmations, individuals can gradually shift their mindset and build self-confidence. Recognizing and celebrating personal strengths and achievements can counteract negative self-talk and reinforce a more positive self-perception. Setting realistic goals and celebrating progress. Setting realistic goals is an important aspect of building self-confidence. By breaking larger goals into smaller, achievable steps, individuals can experience a sense of progress and accomplishment. Celebrating each milestone along the way can further reinforce self-confidence. It is crucial to set goals that are specific, measurable, attainable, relevant, and time-bound, SMART goals. This approach allows individuals to track their progress and stay motivated. By acknowledging and celebrating even the smallest achievements, individuals can build a positive mindset and boost their self-confidence. Embracing a growth mindset. Embracing a growth mindset is essential for individuals with ADHD to build self-confidence. A growth mindset recognizes that abilities and intelligence can be developed through effort, practice, and learning from mistakes. By viewing challenges as opportunities for growth and improvement, individuals can approach tasks with a positive and resilient mindset. A growth mindset encourages individuals to embrace challenges, persist in the face of setbacks, and seek out new strategies and solutions. By reframing failures as learning experiences and focusing on continuous improvement, individuals can cultivate self-confidence and resilience. In conclusion, building self-confidence is a crucial aspect of managing ADHD. By understanding the impact of ADHD on self-confidence, celebrating strengths and accomplishments, developing coping strategies, seeking support, practicing self-care and mindfulness, challenging negative self-talk, setting realistic goals, and embracing a growth mindset, individuals with ADHD can cultivate a positive self-image and thrive in various aspects of their lives. 12.2 Setting and achieving goals. Setting and achieving goals can be a challenging task for individuals with ADHD. The symptoms of ADHD, such as difficulty with organization, impulsivity, and distractibility, can make it hard to stay focused and follow through on goals. However, with the right strategies and techniques, individuals with ADHD can learn to set realistic goals and develop effective strategies to achieve them. The importance of goal setting. Goal setting is an essential skill for everyone, but it is particularly important for individuals with ADHD. Setting goals provides a sense of direction and purpose, helps prioritize tasks, and increases motivation. When individuals with ADHD have clear goals, they are more likely to stay focused and engaged in their activities. Setting SMART goals. One effective approach to goal setting is to use the SMART framework. SMART stands for specific, measurable, achievable, relevant, and time-bound. Let's break down each component. Specific. Goals should be clear and well-defined. Instead of setting a vague goal like, improve my grades, a specific goal would be, raise my math grade from AC to AB by the end of the semester. Measurable. Goals should be quantifiable so that progress can be tracked. For example, instead of setting a goal to exercise more, a measurable goal would be exercise for 30 minutes, 3 times a week. Achievable. Goals should be realistic and attainable. It's important to set goals that are challenging but within reach. Setting unrealistic goals can lead to frustration and disappointment. For example, if you struggle with time management, setting a goal to complete all your tasks in half the time may not be achievable initially. Instead, start with smaller, more manageable goals and gradually increase the difficulty. Relevant. Goals should align with your values, interests, and long-term objectives. It's important to set goals that are meaningful to you and contribute to your overall well-being and success. Time-bound. Goals should have a specific time frame for completion. Setting deadlines helps create a sense of urgency and prevents procrastination. For example, instead of setting a goal to read more books, a time-bound goal would be read 1 book per month for the next 6 months. Breaking down goals into smaller steps. For individuals with ADHD, large goals can feel overwhelming and lead to procrastination. Breaking down goals into smaller, more manageable steps can make them less intimidating and increase the likelihood of success. This approach is known as chunking or task decomposition. Start by identifying the main goal and then break it down into smaller sub-goals or tasks. Each sub-goal should be specific, measurable, achievable, relevant, and time-bound. By focusing on one small step at a time, you can maintain momentum and build confidence as you make progress. For example, if your goal is to clean and organize your entire bedroom, you can break it down into smaller tasks such as sort and declutter clothes, organize books and magazines, clean and organize desk area, rearrange furniture for better flow, vacuum and dust the room. By tackling one task at a time, you can avoid feeling overwhelmed and increase your chances of completing the larger goal. Utilizing strategies for goal achievement. In addition to setting SMART goals and breaking them down into smaller steps, there are several strategies that can help individuals with ADHD achieve their goals. Visualize success. Take a few moments each day to visualize yourself successfully achieving your goals. Imagine how it will feel and the positive impact it will have on your life. Visualization can help increase motivation and focus. Create a plan. Develop a detailed plan of action for each goal. Break down the steps, assign deadlines, and create a schedule. Having a clear plan can help you stay organized and on track. Use reminders and cues. Individuals with ADHD can benefit from using reminders and cues to stay focused and remember important tasks. Set alarms, use sticky notes, or utilize smartphone apps to prompt you to take action. Seek accountability. Share your goals with a trusted friend, family member, or coach who can provide support and hold you accountable. Regular check-ins and progress updates can help keep you motivated and on track. Celebrate milestones. Acknowledge and celebrate your achievements along the way. Rewarding yourself for reaching milestones can boost motivation and reinforce positive behaviors. Stay flexible. It's important to remain flexible and adaptable when working towards your goals. Life can throw unexpected challenges your way, and it's essential to adjust your plans accordingly without losing sight of your ultimate objective. Overcoming setbacks and maintaining motivation. It's common to face setbacks and obstacles when working towards goals, especially for individuals with ADHD. It's important to remember that setbacks are a natural part of the process and should not be seen as failures. Here are some strategies to help you overcome setbacks and maintain motivation. Reflect and learn. Take time to reflect on what went wrong and what you can learn from the setback. Use it as an opportunity to adjust your approach and develop new strategies. Seek support. Reach out to your support network for encouragement and guidance. Share your challenges and ask for advice. Sometimes, a fresh perspective can provide valuable insights. Practice self-compassion. Be kind to yourself and practice self-compassion. Remember that setbacks are not a reflection of your worth or abilities. Treat yourself with understanding and patience as you navigate the ups and downs of goal achievement. Revisit your why. Remind yourself of why you set the goal in the first place. Reconnecting with your motivation can reignite your drive and help you push through challenges. Adjust and adapt. If you encounter significant obstacles or realize that your goals need to be adjusted, be willing to adapt. Flexibility is key to long-term success. By implementing these strategies and maintaining a positive mindset, individuals with ADHD can set and achieve meaningful goals. Remember that progress is more important than perfection, and each step forward is a step towards success. 12.3 Maintaining motivation. Motivation plays a crucial role in managing ADHD. It is the driving force that keeps us focused, engaged, and determined to achieve our goals. However, individuals with ADHD often struggle with maintaining motivation due to the challenges they face with attention, impulsivity, and hyperactivity. In this section, we will explore strategies and techniques to help individuals with ADHD maintain their motivation and stay on track towards their goals. Understanding motivation. Before diving into specific strategies, it is important to understand the nature of motivation and how it affects individuals with ADHD. Motivation can be categorized into two types: intrinsic and extrinsic. Intrinsic motivation refers to the internal desire and enjoyment that comes from engaging in an activity. It is driven by personal interest, curiosity, and a sense of accomplishment. For individuals with ADHD, tapping into their intrinsic motivation can be particularly beneficial as it helps them stay engaged and focused on tasks. Extrinsic motivation, on the other hand, comes from external factors such as rewards, recognition, or avoiding punishment. While extrinsic motivation can be helpful in certain situations, it is not always sustainable in the long run. Individuals with ADHD may struggle with relying solely on external rewards to maintain their motivation. Setting meaningful goals. One of the key factors in maintaining motivation is setting meaningful and achievable goals. When individuals with ADHD have a clear vision of what they want to accomplish, it becomes easier to stay motivated and focused. Here are some tips for setting goals. Make goals specific and measurable. Clearly define what you want to achieve and establish measurable criteria to track your progress. For example, instead of setting a vague goal like, improve my grades, set a specific goal like, increase my math grade by 2 points by the end of the semester. Break goals into smaller tasks. Large goals can feel overwhelming and may lead to a lack of motivation. Break them down into smaller, manageable tasks that can be accomplished step by step. This approach provides a sense of progress and achievement along the way. Set realistic deadlines. Establishing deadlines for each task helps create a sense of urgency and keeps you accountable. Be mindful of setting realistic deadlines that consider your ADHD-related challenges and allow for flexibility when needed. Celebrate milestones. Acknowledge and celebrate your achievements along the way. Rewarding yourself for completing tasks or reaching milestones can boost motivation and provide a sense of accomplishment. Creating a supportive environment. A supportive environment can significantly impact motivation levels for individuals with ADHD. Here are some strategies to create an environment that fosters motivation. Minimize distractions. Reduce external distractions as much as possible. Create a quiet and organized workspace where you can focus on your tasks without interruptions. Use noise-canceling headphones, block distracting websites, and establish clear boundaries with others to minimize distractions. Surround yourself with supportive people. Build a network of supportive individuals who understand your challenges and can provide encouragement and motivation. Share your goals with them and seek their support when needed. Find an accountability partner. Having someone to hold you accountable can be highly motivating. Find a friend, family member, or mentor who can check in on your progress and provide support and encouragement. Seek professional help. Consider working with a therapist or coach who specializes in ADHD. They can provide guidance, strategies, and support to help you maintain motivation and overcome challenges. Utilizing strategies for focus and time management. Maintaining motivation requires effective strategies for managing focus and time. Here are some techniques that can help. Use visual reminders. Visual cues, such as sticky notes, calendars, or task boards, can serve as reminders and keep you on track. Place them in visible locations to help you remember your goals and tasks. Break tasks into smaller chunks. Large tasks can be overwhelming and lead to a lack of motivation. Break them down into smaller, more manageable chunks. Focus on completing one chunk at a time, which will provide a sense of accomplishment and keep you motivated. Utilize timers and alarms. Set timers or alarms to create a sense of urgency and structure. Use them to allocate specific time blocks for tasks and take regular breaks to prevent burnout. Practice the Pomodoro technique. The Pomodoro technique involves working in focused bursts of time, typically 25 minutes, followed by short breaks. This technique can help maintain motivation by breaking tasks into manageable intervals and providing regular breaks for rest and rejuvenation. Cultivating self-care and well-being. Maintaining motivation requires taking care of your physical and mental well-being. Here are some self-care strategies that can support your motivation. Prioritize sleep. Getting enough quality sleep is essential for maintaining focus, energy, and motivation. Establish a consistent sleep routine and create a sleep-friendly environment to ensure you are well rested. Engage in regular physical activity. Exercise has been shown to improve focus, attention, and overall well-being. Find physical activities that you enjoy and incorporate them into your routine. Practice stress management techniques. Stress can negatively impact motivation. Explore stress management techniques such as deep breathing, meditation, mindfulness, or engaging in hobbies and activities that help you relax and unwind. Take breaks and practice self-compassion. It is important to give yourself permission to take breaks when needed. Be kind to yourself and practice self-compassion. Remember that setbacks and challenges are a normal part of the journey, and it's okay to ask for help when needed. By implementing these strategies and techniques, individuals with ADHD can maintain their motivation and stay focused on their goals. Remember that motivation may fluctuate, and it's important to be patient and persistent. With time and practice, you can develop a strong sense of motivation that will support you in thriving with ADHD. 12.4 Embracing your strengths. Living with ADHD can present many challenges, but it's important to remember that it also comes with unique strengths and abilities. Embracing these strengths can help you navigate through life with ADHD and thrive in various aspects. In this section, we will explore some of the common strengths associated with ADHD and discuss how you can harness them to your advantage. 1. Creativity and innovation. One of the most notable strengths of individuals with ADHD is their creativity and ability to think outside the box. Many people with ADHD have a natural inclination towards creative pursuits such as art, music, writing, and problem solving. Their ability to see connections and patterns that others may miss can lead to innovative ideas and solutions. To embrace this strength, consider exploring creative outlets that align with your interests. Engage in activities that allow you to express your unique perspective and tap into your creative potential. Whether it's painting, playing an instrument, or writing stories, find ways to channel your creativity and let it flourish. 2. Hyperfocus. While ADHD is often associated with difficulties in maintaining focus, individuals with ADHD also have the ability to hyperfocus on tasks that capture their interest. Hyperfocus refers to the intense concentration and absorption in a particular activity, often to the point of losing track of time. To harness this strength, identify tasks or projects that genuinely captivate your attention. When you find yourself in a state of hyperfocus, take advantage of it by dedicating uninterrupted time to work on those tasks. Create a conducive environment that minimizes distractions and allows you to fully immerse yourself in the activity. By leveraging your hyperfocus, you can accomplish tasks with exceptional focus and productivity. 3. High energy levels. ADHD is often associated with high levels of energy and restlessness. While this can sometimes be challenging to manage, it can also be a valuable asset. Individuals with ADHD often have a surplus of energy that can be channeled into productive activities. To make the most of your high energy levels, engage in physical activities that allow you to release excess energy and improve your overall well-being. Regular exercise, such as jogging, swimming, or playing sports, can help you channel your energy in a positive way. Additionally, consider incorporating movement breaks into your daily routine to help maintain focus and productivity. 4. Ability to multitask. Contrary to popular belief, individuals with ADHD can excel at multitasking. While it's true that multitasking can be overwhelming for some, those with ADHD often have the ability to juggle multiple tasks simultaneously. To leverage this strength, practice effective multitasking techniques. Break down larger tasks into smaller, manageable chunks and allocate specific time slots for each task. Utilize tools such as to-do lists, calendars, and reminders to help you stay organized and on track. By effectively managing multiple tasks at once, you can maximize your productivity and accomplish more in less time. 5. Resilience and adaptability. Living with ADHD requires constant adaptation and resilience. Individuals with ADHD often face unique challenges and setbacks, but they also possess a remarkable ability to bounce back and persevere. To embrace this strength, cultivate a growth mindset and view challenges as opportunities for growth and learning. Develop strategies to cope with setbacks, such as practicing mindfulness, seeking support from others, and maintaining a positive outlook. By embracing your resilience and adaptability, you can navigate through the ups and downs of life with ADHD and emerge stronger and more resilient. 6. Intuition and intense focus. Individuals with ADHD often have a heightened sense of intuition and the ability to intensely focus on tasks that capture their interest. This can be particularly advantageous in situations that require quick decision-making or deep concentration. To harness this strength, trust your instincts and listen to your intuition. When faced with important decisions, take the time to reflect and tap into your inner wisdom. Additionally, identify tasks or projects that align with your passions and interests. By engaging in activities that captivate your attention, you can tap into your intense focus and achieve remarkable results. 7. Ability to think outside the box. ADHD often brings a unique perspective and the ability to think outside the box. Individuals with ADHD often have a knack for finding unconventional solutions to problems and approaching tasks from a different angle. To embrace this strength, challenge yourself to think creatively and explore alternative approaches to problem solving. Embrace your unique perspective and don't be afraid to share your ideas and insights with others. By thinking outside the box, you can bring fresh perspectives and innovative solutions to various aspects of your life. In conclusion, while ADHD may present challenges, it also comes with a range of strengths and abilities. By embracing and harnessing these strengths, you can navigate through life with ADHD more effectively and thrive in various areas. Remember to celebrate your unique qualities and use them to your advantage.